name and then you can talk. All right, so this is officially being recorded now. And so we'll also invite those of you who are joining us from different parts of the country, of the continent, to share in the chat box where you're watching from, where you're following this from, and if you have any comments or questions. Because we are conscious of time, we may not be able to get all of your questions or queries answered. There is still no harm in telling us where you're coming in from and what your question could be, especially as the presenters continue and the panelists as well. And so once again, we welcome your views, but only strictly on the chat box to allow us to have an uninterrupted and engaging session, which we're going to have today. As you've just heard, this session is going to be recorded and the recording will be made available after the event for those of you who've registered. And of course, we encourage you to introduce yourself in the chat box. And there's also hashtags to use because we need to make women economic empowerment. It's always been a global conversation. Let's scale it, especially with the launch of the community of practice. It's so critical that we are able to scale these conversations and engage in them as well. And we can do that on this digital platform. The hashtags are several. I'll read them all, and either of them will be able to be tracked in terms of what people are saying around this conversation. Hashtag unpaid carers, hashtag care for care, hashtag unpaid caregivers, hashtag domestic workers, hashtag women empowerment, hashtag women underscore economic underscore empowerment, hashtag gender equality, hashtag evidence-based, and hashtag evidence-based practice. We'll probably see that they can be listed on the chat box for you to be able to see them and continue to say them. And so, of course, the community of practice is supported by the Bill and Melinda Gates Foundation and coordination, and the functions are being coordinated by ICRW, who we'll hear from in just a minute. And all the organizations present, we will invite our host ICRW to speak to that and to thank them as well. And so with that, I've taken about 3 minutes on that, and now I'm going to time myself for another 1 minute to talk a little bit about myself and why I'm so invested in this conversation. I'm a media personality, the founder of Inua Dada Foundation. And Inua Dada really speaks to economic empowerment, access to justice, and access to psychosocial support for survivors of gender-based violence. And when I say access to support, I'm also talking about economic empowerment as we await a pad-making machine that will allow women within the Korogosho community and hopefully beyond to make sanitary products and earn a wage from that. We've been in the space of menstrual equity for a long time. And I'm also a consultant and lead for Better for Kenya, where we work with influencers to amplify gender equality messaging. And the hashtag there is Better for Kenya. Now, why is this important to say? Women economic empowerment. I like to dissect technical terms, but what I've realized is that even for women who have access, it's not always automatic that there's access to economic empowerment. Sometimes the links are disrupted and interrupted in many ways. And so we need to think about those who are left furthest behind. That's always a key concern for me, is how are we ensuring that economic power is in the hands of women? Because without that, there's a disruption when you're accessing justice, opportunities, even accessing safety. If you don't have that economic power, that becomes a hindrance to thriving and progressing in your own space. I'm deeply passionate about it. Unpaid caregiving work is something that I look at every day. And again, this is me speaking from a point of access. And you can imagine, I'm able to get people to help sometimes with my role as a mother and trying to work and also trying to balance caregiving. Right now, as we speak, in fact, my sons are with my parents, and I say, see, as my mom, I was telling her, this is why it's important that this is credited as something that needs to be funded or put forefront in terms of economic empowerment. So I thought I'd introduce myself, talk about the hats I wear, and talk about why I think it's so critical that we have this conversation. And hopefully by the end of this, we have the relevant authorities saying, we have no choice. We really need to make this a reality based on the data and evidence that will be presented by our speakers and panelists today. So as we're watching and listening and internalizing, let's participate in progressing economic empowerment to reach everyone, especially those who are left furthest behind. When we say leave no one behind, let's speak to the spirit of that. So let's listen, take notes, be engaging. And beyond this, let's amplify these conversations. Please understand that this is about every single one of us. And that's why we talk about it being better for Kenya, because it's better for everyone. And so with those few remarks, if I can say that, I would now like to invite Dr. Eric Yegon, who's going to give us a few opening remarks and talk to us a little bit about what it is and how it is that we've come together today and what it is that we're hoping to take home. And at the end of this conversation, what are we saying? So he is the Senior Gender and SRH Specialist and Project Director for Women Economic Empowerment, COP, ICRW Africa. Dr. Eric Yegon, welcome.
Thank you very much, Janet. Good afternoon, colleagues, and good morning, friends from around the world. On behalf of the International Center for Research on Women, I'm pleased to welcome you to the launch of the initiative of On What Works on Women Economic Empowerment Practice in Kenya. This investment is funded by Bill and Melinda Gates Foundation. It focuses on defining a learning agenda and developing a knowledge sharing framework that enables community of practice members to be able to share and disseminate their learnings to inform the field. This investment will engage and collaborate with key stakeholders at community, county, national, and regional levels to actively collaborate and generate and use evidence to improve women economic empowerment programs and policies in this country. So this is actually a learning agenda community of practice that will contribute to the body of work on building programs and policy evidence on what works through an in-country learning partner that ICRW is leading. And these investments would work with a number of partners here in Kenya to bring them together. These partners are doing research and also policy work to really form a community of practice that will ensure efficiency, effectiveness, and sustainability of the ongoing work on women economic empowerment in Kenya. So this community of practice will thoughtfully facilitate collaborations and partnerships and would help leverage different strengths from different partners to improve the quality and the synthesis of emerging evidence that will be used to inform decision-making on women economic empowerment programs. We'll also be happy to work with through this community of practice to help share best practices and strengthen the exposure of various members of community of practice so that we can build an arsenal of research tools, because ICRW is a research and learning institution. I want to thank all the members who have been very generous with their time and have been fully engaged in establishing this community of practice. In the last 2 months, we have engaged close to 40 partners from the public, from non-governmental organizations, from private sector, the academia, and civil society organizations across different levels, and also individual researchers and practitioners who have agreed to partner with us on this community of practice. We look forward to working with all our partners in making this community of practice truly meaningful to their work. In the coming months, the community of practice will roll out a number of initiatives to really engage our partners and amplify this work in Kenya. This work that the community of practice will be doing will collaborate with the East Africa Women Economic Empowerment Evidence and Advocacy and Communications Hub that ActionAid is leading here in Kenya, but also globally on women economic empowerment and advocacy that ICRW in our Washington DC office is leading. We'll basically work at these policy levels, both locally and globally, to be able to disseminate all this knowledge that we are learning. So today, we will hear from important work that the partners of community of practice have been working on in this country. And today we focus in the thematic area of unpaid care and domestic work. That is a current priority area for the State Department for Gender in Kenya. To reach where we are today, we've engaged with a number of partners, including the team from Busara Center for Behavioral Economics, the Bill and Melinda Gates Foundation, and the State Department for Gender, who have provided valuable insights in planning the launch of this community of practice. I also want to thank partners who will present their work today, and we look forward to more partners making their presentations in the future. As a community of practice, we look forward to collaboration with various actors to build a body of evidence to and inform policy on women economic empowerment. I want to extend our appreciation for the State Department of Gender for its continued strategic engagement of partners and vision towards women economic empowerment in Kenya. I take this time to invite the Honorable Dr. Chebi Kilimo, the Chief Administrative Secretary, State Ministry of Public Service, to make our opening remarks and welcome us to this launch. Dr. Kilimo, please welcome.
Hello, can I be seen?
Yes, we can hear you.
Oh, you can hear me? Okay, I thought my video would come there. Thank you very much, Dr. Yagon, and all of us present here. Good afternoon. Yes, and good morning wherever you are or wherever you may be joining us from. It gives me a great pleasure to join all of you in this important occasion on the launch of the Women Economic Empowerment Community of Practice in Kenya. I'd like to begin by congratulating you all for coming together to create this initiative because this is a true indication of the realization that overcoming poverty, achieving women's economic empowerment will not result from single, specific, or isolated projects and programs, but from a comprehensive approach that involves multiple stakeholders, other sectors, coming together in a concerted effort and pulling in the same direction. Evidence has pointed to the strong linkage of our country's gross domestic product and women's economic and labor force participation. The strengthening the economic role of women is critical to reducing poverty, improving health, and education outcomes, thus achieving other broad development goals, which include the Sustainable Development Goals. It is with great admiration that the theme of today's launch is unpaid care and domestic work. This launch provides us as stakeholders a platform to take a deep dive into one of the overlooked challenges facing women locally and even globally. At the global stage, unpaid care has been identified as a major barrier towards gender equality and women's economic empowerment. In many nations, the manifestation of unpaid care and domestic work ranges from cooking, cleaning, fetching water, firewood, to caring for children, caring for the elderly, the sick people, and those with disabilities. With the mention of these duties and responsibilities, there is no doubt that unpaid care and domestic work remain an important element of a woman's life. Know that caregiving is so naturally for a woman. Take into consideration somebody falling or a child falling. The first person to jump to want to help is a woman. And so it comes naturally for them to do caregiving work. And this is very good coming this time that it has come of age for us to take into consideration the work done by women. So globally, women perform about 76% of unpaid care work, which is over 3 times more than men. Unpaid care work is also one of the main reasons why 42% of women globally are outside the paid workforce, compared to just 6% of men. Now, if we come back here in Kenya, for those who are listening and they're from Kenya, our population is about 51% female, and the other 50 or 49% is about men. And so this is a big population that is not, that is offering work, yet it is unpaid. Among women, the unpaid care and domestic work burden is exacerbated by existence of structural, cultural, legal, institutional and historical challenges that hinder them from entering paid work and scaling their economic enterprises. Taking another example from Kenya, you will find where we have family challenges that the girl child will surrender, are going to school to take care of their ailing parents. Or in a family setup, the woman always stays behind to care for the sick or those with disability without considering what might it cost. So the disproportionate responsibility for unpaid care work results in time poverty and significant opportunity costs, particularly among the poorest and most marginalized women and girls. Today, I'm just from attending a function where we were talking about credit for women, and there was a discussion who talked about cross-border trade. Yet, the most energetic women are still, the most energetic women who are still engaging in business are those who are also in the childbearing age. So you can imagine, this study was shared by Professor Mbithi from the Women Economic Hub of Nairobi, and they've done a study in Busia and Kajiado. And they've said, when they constructed child centers for keeping children, women were able to do business much better. And I think that is the direction to go. So if the energetic women who are still able to do business are left behind doing unpaid caregiving work, or their caregiving work is not paid for, then how are we going to be economically empowered? And so this coming together, and I know that that report is with the State Department of Gender, with all of you, community of practitioners coming together, we are going to put value to the work that women do. They actually do quite a lot, so that the sacrifice that they give to the community, to the nation at the end of the day, is also accounted for, is given value. That is when people start beginning to say, yes, I am a house manager, because her work is paid for. Where they are caring for the elderly and the sick, because that is a major setback where people need to be cared for. Can we put in our policies, which I hope it will be there, that somebody is staying back to take care of this, they have this stipend. You're caring for a PWD, you are paid this stipend. You have elderly parents, you are paid this stipend. So that it is not just that the girl child or the mother, the woman is told, come and take care of the ailing old parents, and nothing is paid, and they have to depend on other working siblings for support. We want the government to own all the people, and it can only happen when all of you come together like you have come now and make a policy, which I know we are working at the ministry, but definitely at the State Department, but definitely this information today will go a long way in informing. And from a woman's point of view, this is the best thing that can happen to the women of our country. They will be serving with joy. So I'd like to take note that the government of Kenya, through the State Department of Gender, is mandated to implement programs and projects on women empowerment. And the department is also responsible for undertaking research and developing policies on gender equality and empowerment of women. It is worth noting that COVID-19 pandemic reinforced the importance of women economic empowerment and addressing certain structural and gender barriers. The global gains on gender parity have been heavily eroded by the pandemic. More women than men have lost formal employment, drifting into unstable informal entrepreneurship and unpaid care work. COVID-19 also exacerbated the care burden and increased economic, social, and mental vulnerabilities experienced by women in the immediate and long term. As I said, it comes so naturally for women to be caregivers. We cope launch today, launch that we are, the Women Economic Empowerment Community of Practice launch provides us a platform to share evidence-based insights and learnings that could be used for the policy development. And I invite all to make concrete contributions and deliberations that can provide solutions for increasing women participation in Kenya's economic growth and amplifying their voices in the society. And as we launch the community of practice on women empowerment in Kenya today, the State Department of Gender also recognizes and affirms the strong need and demand for data to inform better policies and practices that support women's economic activities. As a key stakeholder in this initiative, and as a consumer of knowledge generated through the Women Economic Empowerment Challenge, all the researchers and practitioners engaged in this initiative to undertake rigorous research and produce high quality data that can be translated into clear policy asks. Let me pause a little bit and talk like a politician there. Unless there are clear-cut policies on how to implement, every regime will come with their own ideas and create a new one instead of improving on what is there, instead of reviewing what is there. Somebody will go to parliament and just say, I want to this law and do like this. But when new community of practices, of practitioners come together, and I really pray that it shall be done while we are still in office, because we have a gender sensitive president at this particular time, we come up with this policy, it will be easier, especially as we change leadership at the end of next year, that we shall have protected the space for women, the homemakers, the caregivers, our mothers and our sisters. So really, I am counting on you, speaking as a woman and speaking as part of the policy or the people who are making this policy. It is my sincere hope that today's launch and subsequent activities by the community of practice will continuously seek to provide answers to persistent gaps and challenges that impede gender equality and women's economic empowerment. I do believe that today's session will provide the State Department for Gender with important insights that can inform the unpaid care and domestic work policy, which I said the State Department is currently working on. I urge you all to work with the department, not only on unpaid care work, but in all other determinants of women's economic empowerment. I welcome you all and wish you fruitful deliberations as you engage in candid discussions on how the evidence you have separated over the years and which you continue to generate can shape the future of women in this country and beyond by making their livelihoods more decent, equitable, and sustainable, considering that not all of us will be able to work in towns. Some will remain in the villages, and there in the villages, this policy will address their unpaid caregiving, their unpaid work that they do back in the villages as our children grow up standing on the shoulders of their mothers. It is now my great pleasure to declare the Women Economic Empowerment Community of Practice in Kenya officially launched. I thank you.
Thank you so very much for that, Honorable Jebi Kilimo, for speaking very much to the heart of the pain points of where economic empowerment for women can fail women if it's not achieved. So thank you for speaking to childcare. for speaking to, the 76% unpaid care work around the world, and for speaking to time poverty, all of which are very tangible results and tangible issues that need to be addressed through women economic empowerment. We thank you so much for declaring this launched as well. We now would like to invite Ms. Sarah Nduta, Gender Specialist, ICRW Africa, to talk to us a little bit more about the overview of Women Economic Empowerment Community of Practice project. Thank you. Welcome.
Thank you so much. Next slide, please. Thank you, and good morning, good afternoon to you all, and thank you so much for joining us in this important event. So I will quickly take us through a very brief presentation that provides an overview of the project that we are talking about. And I would like to begin by first thanking all of you for responding to the brief questionnaire that we sent out last week that was able to collect information on the location of our work and the thematic areas of our research programming. So a quick look into the findings from that brief survey as presented in this slide is that a lot of our work is located in Nairobi, in central and in western parts of Kenya. And as indicated on the map that's on the right. However, we take note that these results is only from about 50% of the partners that we have already engaged, but then it already begins to provide us with an idea of where our women economic work is likely to be happening. We take note that there's very limited presence of women economic empowerment work that is happening at the northern part of the country, at the eastern part of the country, which are areas that we know from evidence have strong cultural practices and negative gender norms that inhibit women participation in women economic empowerment. So that is food for thought for all of us. And we also take note that perhaps there might be some work that is happening in these areas, but we may need to devise mechanisms as a community of practice on two main fronts. First, how do we scale work into these areas if there is limited work that is happening in those areas? And secondly, who is working in those areas and is not in our team or in our list of membership, so that we can be able to reach out to them and onboard them into this community of practice in the spirit of leaving no one behind, because the essence of this community of practice is to bring together all the undertaking research in the area of so that we can learn together, build our knowledge, and avoid duplicating efforts across the where we work. In terms of the thematic areas of work, from the survey, we note that most of the organizations are working on research programs around training, education, capacity building. In the coming days, we will engage with the partners to get more insights into what kind of work they are engaging in terms of the themes and the key results that they are seeing, which could be specific to particular counties or particular locations. Next slide, please. Thank you. So this slide basically discusses our three main objectives that will guide how we operate in the next 3 years. Our first objective is to establish the Women Economic Empowerment Community of Practice in Kenya that will basically coordinate and support a diverse group of researchers and practitioners from different parts, from the non-profits, from the privates, from the public institutions, so that we can come together as one voice and consolidate our evidence and begin to see our evidence speaking and making changes at policy level and even in practice. So on this, we've already had introductory meetings with close to 40 partners, a majority of whom are represented in this meeting today. The process for onboarding is still ongoing, and we request you to continue nominating other organizations that you think would make a great fit for this great initiative. The second objective is to basically develop a learning agenda, learning questions for the community of practice. And so this basically means that the members will decide areas of work that they want to deepen their knowledge in, the thematic areas they want to focus on, and basically what interests them as a community. The third is to synthesize evidence on women's economic empowerment and to disseminate the findings. So we will together develop a knowledge sharing platform. We will analyze the data that we have already generated. We will synthesize that data together and be able to disseminate at various levels, at the local, regional, and international levels. So our role as ICRW in all of this is to basically facilitate and enable partner connections for us to be able to network and to engage and to basically work and uplift the lives of women who are either in business or in employment. Next slide, please. Thank you. So in this slide, we look at, this slide speaks to the different policy investments that Gates has put in place and how they impact and interact with our community of practice. On the top, the circle that is on the top represents our community of practice that will undertake activities and basically do what I've just described in the previous slide. The circle with the beige color, the one that is on the bottom left, represents the policy advocacy work that is being led by ActionAid, which is happening at both local and regional levels. Essentially, ActionAid will look at our learnings from the COP and will take lead in efforts to engage government in terms of packaging that evidence and disseminating the research to be able to have solid policy asks and present them to government. And ActionAid will be launching their coalition this week on the 25th of this month. So we are also looking forward to that. The other circle, the one that's on the bottom right, represents our work on the Global We advocacy efforts that is being led out of the ICRW's US office. And the Global We Hub team will drive the evidence on what works to advance women economic empowerment, advocacy, and collectives, and integrate policy actions through major global forums, institutions, and with donor countries. They will strengthen the global framework to support the advancement of women economic empowerment and develop necessary global communications efforts to support advocacy goals. So how all these circles interconnect is that the learning that is generated through the COP will inform the policy advocacy efforts at the national level and at the global stage. And again, through the ICRW-led policy advocacy hub, the learnings from the global level will then trickle down and inform a lot of what is happening here locally and even regionally. So essentially, this is what the COP is set out to do and achieve in the long run. And we're looking forward to your active participation and your active engagement in this project, even as we launch it. So thank you so much. Handing it over back to you, Janet. Thank you.
Thank you so much for those insights, Sarah. We appreciate them, and they also set the tone for the presentations we're about to see. Before I continue and invite our next speaker, just another quick announcement for housekeeping. There seem to be a lot of people who've logged in as Professor Simon Onwere as well as Eric Yegon. Kindly rename yourselves by putting in your names there so that we avoid any confusion that it might be causing. And another kind reminder to please be muted and keep your videos off, especially when we have our presenters coming on. For those who are joining us today, and we thank you for joining us from around the world, please just be muted, keep your camera off so that we have seamless presentations that we've already begun to see. And with that, as we appreciate the work that Sarah is doing and how she's really explained and defined a lot of how community of practice and we come together, I'd like to now invite Ms. Nancy Sitonik, Principal Gender Officer, Directorate of Gender, State Department for Gender, to talk a little bit about the overview of the State Department for Gender's plans for national policy on gender and unpaid care work. Such an important conversation. Karibu Sana, thank you for joining us. Over to you.
Okay, good afternoon, everyone. My name is Nancy, as I've just been introduced, and I'm going to take you through the plans that the State Department for Gender has in place in the development of our unpaid care work policy in Kenya. I am going to start by demystifying the word unpaid care. And I'll start by saying unpaid care work is work that is not economically quantified nor remunerated. It is a concern because it is a hindrance to achievement of gender equality and women economic empowerment. So it is a critical development and economic gender equality issue in Kenya. Next slide. So the causes of this unpaid care work, or why our people engage in unpaid care work, is because of cultural orientation and social norms. Domestic and care activities are largely viewed as women's work, generating and social pressure for women to carry out disproportional amount of unpaid care work. Legislative and policy framework governing and social institutions. Work policies and social institutions, such as provision of care services, lead to more unpaid care work for women, particularly mothers. And even economic environment and labor structures, hiring policies, social protection, and wages subject with undesirable working environment and discourage them from engaging in formal paid work and inadequate skills and infrastructure, which has the potential to reduce domestic workload. Next slide. On the impact of unpaid care work, it results in time poverty and significant opportunity costs, particularly among the poorest and the most marginalized women and girls. It contributes to decreased education and skills development for girls and women, under women and girls' rights by excluding them from opportunities to engage in social, economic, and political spheres. It is one of the main reasons why 42% of women globally are outside the paid care workforce compared to just 6% of men. It increases the gap between the poor and the rich. It also increases mental health issues. Next slide. The types of unpaid care work in Kenya is child care, which is men in this particular type of unpaid care. 39.2% of men engage in the unpaid child care work, while 52.7% are women. Food and food preparations, 24.2% of men, while women are 44.2%. Care for dependent adults, 30.8% for men and 34.7% for women. Shopping for households, 16% for men and 17% for women. That is, the source was from Kenya National Bureau of Standards. The next slide. The main challenges and the way forward are quantifying and attaching value to unpaid care and domestic work, which is largely contributed by women. The state agencies and the community of practice are required to carry out evidence-based policy advocacy aiming to reduce the burden of unpaid care domestic work on women to allow them to participate in social, political, and economic life. The proposed national policy on unpaid care work is anticipated to provide broad guidelines implementing strategies to address the unpaid care and domestic work in the country. Next slide. Some of the government interventions are the development of unpaid care policy, which we have already started. There is a concept note which is in place, and there is a committee which has been formed to do the same. And the next one is the national policy on UNCW will integrate unpaid care work with the government development priorities as outlined in the Vision 2030, and this will recognize women as strategic partners, participants in national development. The roadmap to realizing the UPCW policy in Kenya has commenced with the writing of objectives to provide a framework for the development of the unpaid care work policy in Kenya, to sensitize stakeholders to participate in the development of policy, and to mobilize resources for the development for the policy. Thank you for listening. Thank you.
Thank you again for that, Ms. Nancy Sitonic. Again, following closely from what Sarah and Honorable Jebi Kilimo had said, I think it's now becoming so clear in terms of the patterns and the motivation. And one thing is very, very critical and clear is that there is very little progress across the board if economic empowerment is not prioritized. It escalates poverty, it escalates leaving women and girls locked out of opportunities. So let's continue to interrogate this and find a way that we can quantify unpaid work so that we're able to include everyone, because when everyone is included, everyone wins. So thank you so much for that presentation. We are now moving into a series of partner insights and on gender and care work intervention in Kenya and beyond. And what I'll do is introduce each of the speakers just by their name and title. And if they are able to add anything else over and above their own presentation, we invite them to do that. Of course, in the interest of time, we truly hope that we're able to have everyone speak truly to these issues. Again, please participate in the chat box, continue to use the hashtags. And the first person that I would want to call upon is Ms. Eva Muluve, Program Officer with Population Council. Eva, I'd like to invite you, and you can add on a little bit to your bio if you so wish as you proceed with your presentation. Thank you and welcome.
Thank you very much, Janet, and thank you to ICRW for giving us the opportunity to present some of our findings in this forum. So as Janet has said, my name is Eva Muluve. I work at the Population Council Kenya office, and I'm a researcher. And my main focus is on adolescent health and well-being. So Population Council is an organization that conducts research globally and just to address critical health and development needs. So at the Population Council Kenya, we have been conducting several studies with adolescent cohorts in different parts of the country. And one of our studies that we conducted between last year and this year, 2021, was the COVID-19 Knowledge, Attitude and Practice Surveys. And these were basically repeat observational longitudinal surveys with adults and adolescents in Wajir, Kilifi, Nairobi, and Kisumu parts of this country. So the main objective of the CAP surveys was just to understand the social, economic, education, and health effects COVID was having on populations, and also try to include gender disaggregated data from both boys and girls to effectively identify whether there were any gendered impacts, and also to generate data to guide post-COVID-19 adolescent programming and policy work in Kenya. Next slide. So one of the main findings from these studies was around issues to do with inequalities that have been magnified by COVID. And one of the main challenges that came up from the data is the issue around the burden of housework. And this was closely linked to it being a challenge in terms of remote learning during COVID-19. So 85% of adolescents reported that they were actually able to do some sort of remote learning during the school closures last year. And 60% of those adolescents reported that household chores interfered with their ability to learn at home. And more prominently, this was seen in Wajir, where 63% of the participants reported this. With this affecting girls more adversely. So about 74% of girls in Wajir were particularly affected by the issue around housework being a challenge to remote learning when we compared that to boys, who 46 of them were affected. And we saw the same results in Kisumu and Nairobi, especially for the girls who are aged 15 to 19 years. They were more likely also to report this barrier, in contrast to Kilifi, where we saw more boys being affected instead of the girls. We also implemented a number of studies that were qualitative with parents, and the same sentiments were shared by the parents, where one of the fathers in Kajiado stated that you see at home, girls always tend to have more work to do. They have house chores. So the boy child may have some little time left, maybe for private study, but with the girl child, I do not think they have time left after attending to all the home chores. Next slide. So we also have conducted studies in other settings, and some of the negative outcomes that are associated with unpaid work include that girls who are spending more hours doing unpaid chores are less likely to have completed primary school. They are more likely to have lower literacy and numeracy scores. They are also more likely to score low on financial literacy scores. They are more likely to have ever been pregnant and ever been married at a young age. And also particularly to mention about Wajir, that all the negative outcomes stated here have been seen and have been very strongly linked with the girls or the adolescent girls being out of school. So one possible implication is to make sure that girls are in school at primary level, so that they're just doing less chores, but also we need to make sure that it's not just double burdening the girls between doing schoolwork and also the unpaid chores. Next slide, please. So in terms of opportunity for policy and action, we feel that girls' education is important. It's needed to raise the value of girls' education and educate communities on how too much housework can detract girls from school. And norms change work is also needed so that girls and boys are sharing in the housework as schooling rates increase, and also gender gaps in school enrollment decreases, especially in settings like Wajir, as I've mentioned, where there are strong social and cultural norms are also affecting these kind of things. And then consider after school support programs or safe spaces for girls so that they have a place to do their homework and studying without immediately being shifted to doing housework when they arrive at home. And also, if there is need for future remote learning, especially in the context of pandemics or emergencies, then there is need to consider and schedule domestic burdens, to consider the schedule for this remote learning and also the domestic burden for girls. So thank you very much. I will hand it over back to Janet. Janet, you're muted.
Thank you. Sorry about that. I was saying thank you so much for that, Eva. Just very tangible ways there in the policy action and ways to look at the gaps and the burden on the girls. I mean, from a very young age, we begin to see these scale, and it affects the girl's life. Teen pregnancy is one of the issues because of that lack of opportunity and economic empowerment on the household. So thank you very much for speaking to that. I'd now like to invite Dr. Ashley Williams, who is an assistant professor, negotiation Organizations and Markets Unit and Principal Investigator, Busara Center for Behavioral Economics. We welcome you to give your presentation. Thank you so much for being with us.
Yes, thank you so much for having me today. I study time poverty, which is the feeling from a psychological perspective. So the feeling of having too many things to do and not enough time in the day to do them. And most of my research has been looking at the psychological effects of these feelings of time poverty, both caused by objective burden, but also the feeling of overwhelm for outcomes such as subjective well-being, stress, and relationship conflict. Next slide. Very similarly to what Eva was presenting, I've also done research looking at how time use has changed during the COVID-19 pandemic. Some of my colleagues published a paper showing that work hours increased for remote workers who were working primarily via digitally mediated, previous slide, communication such as email and Zoom. So the first bullet point is that work hours increased by about 8.2% for the amount that people were no longer commuting to the office. My own research has expanded on this work and shown through time use surveys that individuals, and especially working women, and in particular working moms, their time use were significantly impacted due to COVID-19 in the same way that Eva was suggesting in your context, Eva. So we see that in the US, Canada, Brazil, Spain, Denmark, and the UK, that working mothers are doing an increasing amount of chores and childcare. And in turn, the amount of chore demands have increased. The increase in chore demands have undermined subjective well-being and happiness. Extrapolating our regression results from our surveys, we would see that working women versus men in the upcoming calendar year would complete 12 more days of chores in 2020 and have 6 fewer days of active leisure. Our data was collected at the beginning of 2019. So next slide. I've also looked at this from a policy perspective. So in a paper that my two postdocs and I wrote last year, we argued that time poverty is often neglected or exacerbated. So paperwork costs about $15 billion in lost wages each year just in the United States. Idle time in the workplace costs companies in the US $100 billion in productivity, and ordeal costs undermine the efficacy of aid. So there's been some research and development economics suggesting that many aid programs force wait times on participants or ask participants to walk very long distances to receive food or other in-kind aid. And so we became interested in this question of trying to identify the causal benefit of reducing the burden of unpaid labor, particularly for those who are struggling to make ends meet and who are most likely to be burdened by time demands, so working mothers. Next slide. This question led us to work together with Busara to build off of some data that I collected over the course of my dissertation, looking at the benefit of removing the burden of unpaid labor via paying people to complete chores on your behalf. You can progress the animation. So in my previous work, I found that people who outsource disliked tasks to others, such as cooking and cleaning, reported significantly greater happiness, more social connection, next, and greater meaning in life. Next animation. And these results held controlling for household income, occupation status, marital status, gender, and age. However, most of these results were conducted in the US or European context. So I wanted to see if the benefits of reducing the burden of unpaid labor chores might have the same positive benefits for women living in East Africa. So continue. So again, I became interested in understanding the causal question of whether removing time poverty could improve the welfare of the working poor. I focused on women and working moms in particular living in Kibera in Nairobi, and partnered with the Busara Center for Behavioral Economics. Can you continue? Keep going. We did you can keep going. Thanks. We did pilot research in this context. Yep, you can progress the animation to understand what chores and childcare looked like for women living in this sample. So we in our pilot data, we observed that women on average spent about 45 hours on paid work per week, about 40 hours on unpaid work per week, including chores and childcare, and made about $12 US per week. Continue. And so we wanted to understand what the causal benefit of removing the burden of unpaid labor might be for women in this sample. And we had a paper accepted at a Nature journal before the results were known. So just our study design was accepted and the results are coming out shortly. So we recruited 1,500 women with school-aged child at home, and we randomly assigned them to 3 conditions. The first condition, they received a time-saving voucher for meals or laundry. In the second condition, they received 500 shillings a week for 3 consecutive weeks of an M-Pesa transfer. And in the control condition, women received a small survey fee for showing up, but did not receive cash windfalls each week. Our end-line measures were well-being, stress, self-investment, and relationship conflict. And we didn't do long-term follow-ups. I think we have 1 long-term follow-up that I can speak to. Continue. So what we did observe is a significant benefit consistent with my original data in the time-saving conditions. So women who received laundry and meals showed an improvement in happiness, a reduction in stress, and an improvement in relationship conflict over the 6-week study. These results persisted after the interventions were removed. You might be interested to note that actually we didn't observe any between condition differences in our study. So this is just looking within the cash or within the time-saving condition. So cash and time performed similarly, as did providing women with the opportunity for small amounts of work. But the cash and time saving conditions operated via different mechanisms. So time saving produced greater gains in subjective well-being, so removing chores like laundry or meal preparation, increased subjective well-being over the course of the study by removing the psychological feeling of being burdened by chores. I'm now replicating these results, looking at time-saving technologies that can save girls and women a significant amount of time. So in particular, I'm working in Rajasthan and looking at removing the burden of collecting water each and every day, which costs about 6 to 8 hours of time each day, and also looking at educational outcomes similar to EVA. So I'm very hopeful that more policy interventions can be targeted to look at the causal benefit of removing the burden of unpaid labor for women, not only in terms of economic development, also in terms of subjective well-being. In our data, we did observe that female entrepreneurs benefited more from the time-saving intervention as opposed to the cash. They were more productive if they had time-saving vouchers, and I'm hoping to explore that finding in future work as well. So thank you very much for having me today, and I look forward to learning from all of you on the call.
Thank you so much for that, Dr. Ashley Whillans. And again, I just appreciate all of the presenters really breaking down from time to cost, and really just looking at the link between all those. And I think presenting this data is so critical in finding specific solutions, some of which are low-hanging fruit, some of which I think need a little bit more interrogation and exploration. And so I think this kind of session is the beginning of linking these all together. I'm just truly fascinated and learning so much. And so I appreciate this platform so much. And so I'd like to now invite Ms. Blandina Bobson, Director of Programs at Oxfam, to make her presentation. Again, you can share 1 or 2 things about yourself as you proceed with your presentation. Thank you, Blandina.
Thanks, Janet, and thanks for this opportunity. So my name is Blandina Bobson. I am the Director of Programs for Oxfam in Kenya, and one of the pillars that we are working in as an organization is on women's rights and gender justice. And
sorry, Blandina, sorry to interrupt. You can put your video on if you so wish, but if not, that's also fine. Thank you.
Sorry about that. Yeah, so one of the pillars that we are working in is on gender justice and women's rights, and the objective is to try and get have women gain power over their lives to participate and contribute in public life. So specifically for this presentation is that we have a project that is titled Addressing Unpaid Care in Domestic Work as a Key Barrier to Gender Equality. Next slide. So the goal of this project is to reignite progress by addressing the largest and the least recognized factor preventing women from reaching their full potential, and this is unpaid care in domestic work. We are doing this in recognition of the fact that unpaid care in domestic work causes time poverty in women, and because of that, they do not have time to engage in economically productive activities, but most of the time is spent on unpaid care in domestic work. And this is not to undervalue unpaid care in domestic work, but it is to say that if it was valued, maybe women would probably find more fulfillment in doing this. It's also to just try and counter the narrative of the fact that people think unpaid care in domestic work is preserved for women, and hence the men in their lives cannot support and cannot redistribute these roles from the women, or rather take the burden. So the objectives we are trying to achieve, or we are looking to achieve with this specific project, is increase public and private sector commitment and investment on unpaid care in domestic work. So we are working with both the government, and we are also looking to influence the private sector to invest in policies that address unpaid care in domestic work in a manner that it reduces unpaid care in domestic work from women, redistributes it, also that we have more women represented in the spaces where decision impacting on unpaid care in domestic work are made, and also just the whole idea of rewarding that work. We are also working towards shifting the public opinions. Please go back to the slide, yes. Public opinions and narratives to acknowledge unpaid care in domestic work as valued work, and also working with women's rights organizations, youth groups, citizens, to have a more collective voice to be able to influence decision-making processes around unpaid care in domestic work. Next slide. The program is being implemented in Kenya, Ethiopia, Zimbabwe, and Uganda, and the Philippines, and we also have a Pan-Africa perspective just to link, the local issues as low as sub-county level to the regional policy related initiatives. So in the course of implementation, some of the key gaps that we have come across are around the retrogressive narrative on unpaid care in domestic work. For most of the women and men that we are working with, every time we try to engage them on rapid care analysis, for them to be able to understand how much time they're spending every day on different activities, the discussion or the feedback has been that this work is meant for women. When you're a woman, the fact that you're born a woman, this is something that is already written for you, that you'll be engaging in this. So for the men, even for some of the women, they do indicate that the men are not supposed to be supporting them. So even as we're trying to shift this narrative, we're also facing a barrier from the women themselves, because they think this is something that women should be doing and not men. There's also uncoordinated efforts in addressing this. And you can see the richness of the presentations that are going to be done here. But I think one weakness has been that most of the institutions are probably working in silos, and it would be very valuable if we all came together, and pulled resources together to be able to address this together, because the issues that we come across at the grassroots are multi-sectoral, and Oxfam as an organization or any other organization would need a different set of technical expertise to be able to address this. And that's why we feel that it's really important that we all come together. And I'm really glad that we have this community of practice that has brought us all together to be able to deliberate on this. The other challenge is around limited representation of women in key decision-making spaces. And this is not just at the national level, it even happens at the grassroots level, where we have the planning and budgeting cycles. We did a study, and one of the findings that came out is that whenever we have these planning and budgeting cycles at the ward levels, it's the men who turn up, the women are not present. And when we asked why they do not go to these, forums, one of the things that came out is that even the timings for these forums that are happening does not allow them to go. It's time when they probably would be taking care of their children. There's also issues around access to resources, where they don't have resources to commute to go to the venues where these participation forums are being undertaken. There's also the lack of, capacity on how to participate in these forums, because they're done sometimes in a very technical manner, and they don't know how to present their priorities as women. Then we have another challenge around budgeting, which is related to just what I alluded to above. And the idea is to have budgets. When budgets are formulated, they need to incorporate an analysis of the public expenditure and methods of raising revenue from a gender lens. What is happening right now is that taxes are being raised in a manner that we're looking at, sectors where, or areas where we could collect as much tax as possible, forgetting that most of the times this goes to the informal economy where most of the women are. And this hurts them because they have small businesses, but these same businesses are being taxed. And if you compare with men who probably have more time to engage in unpaid care and to engage in economic productive activities, then it disadvantages the women. So that's also one of the challenges that exist. Next slide. What we have learned so far is that a citizens-led approach to advocacy on care policies and investments works best because they have the power. They have the power to influence where resources are being invested, by the government. So mobilizing them to participate in some of these spaces does have an impact on care policies. I did mention on the multi-stakeholder approach to addressing unpaid care, mostly because the issues are multi-sectoral and not all institutions would have the capacity to address those. Then there is the element of male engagement in these conversations of unpaid care and domestic work, because when we started, we were just focusing on the women, but then we realized these same women need permission from the men to engage in different activities, and the men need to understand why this is important. So it is very important that we also bring the men on board in the boardrooms and at household level. And then the last one on context-specific approaches to addressing unpaid care and domestic work. So there's a variance in time use in different areas. Informal settlements of Nairobi, we found out that women spent 11.1 hours on unpaid care and domestic work, but Kiambu is different, Kitui is different. So it needs to be, the approaches to addressing these need to be very context-specific. Next slide. So opportunities for policy action, we do see an opportunity, of course, in the planning and budgeting cycles, which can be influenced by the citizens themselves, where they advocate for investment in sectors that would reduce unpaid care and domestic work. There's the care policy scorecard that has been developed, which is a tool that CSOs, government, academia can use to monitor investments by the government on care work or sectors that have an impact on care. There is the time use survey by the Kenya National Bureau of Statistics, which we think we all need to rally around because it's one of those big moments that would probably quantify or add monetary value to unpaid care and domestic work. Devolution, we have the resources decentralized. This is an opportunity that we can use to influence policies at that level. And then developing or strengthening evidence on key care policies for Kenya. So we are saying, women are saying, if you invest in water, you reduce the time for them. But unfortunately, I feel like we don't have concrete evidence to be able to demonstrate that. And we could use this opportunity to just strengthen that evidence base. And then lastly, just evidence-based demonstrating how investments in care policies impact unpaid care and domestic work. Thank you very much.
Thank you so much, Blandine, and especially for speaking to male involvement and shifting narratives in the community, because a lot of this starts from there. If there's a belief and ownership from those who are most affected that there needs to be a shift in narrative and behavior and the approach to the involvement of male and other members of the community, then we begin to even build the appetite for that economic empowerment to happen. So thank you so much for those insights, really helpful. And then there's an interesting comment as I invite our next presenter in the chat box about what would happen if we replaced unpaid labor with paid labor. How would this be paid ideally? Who would do these jobs? So please feel free to keep sending those messages to the chat box. As we said, We'll try our best to get to some of them, and also I'd invite our speakers and panelists to see what is interesting and being picked up on the chat box. Tell us who you are and where you're from as well. And again, slight interruptions coming in once in a while. Please keep your videos off and your microphones on mute when there's a presentation going on. Again, thank you so much for that, Blandina. Let's now invite our next speaker and presenter, Professor Grace Bantebia Kyomuhendo from Makerere University. We welcome you and your thoughts this day for this particular session. Karibu sana and thank you.
Thank you so much for inviting us to be part of this function today. I would like also to request that I put off my video because of the internet instability. At least you know that I'm present in the presentation. I would like also to note that the project I'm going to talk about is funded by the Growth and Economic Opportunities for Women in East Africa, in partnership with the Belinda and Melinda Gates Foundation and William and Flora Elwet Foundation. Next, I'm going to share on the project that has the title of From Promises to Action: Shifting Gender Norms and Public Perception about Unpaid Care Work. I'm glad a lot of context has already been given by the earlier presenters, and it's similar to Uganda. We know that girls and women spend much more hours, twice as much as men. And we also know, as we've heard from other presenters, COVID has increased the burden of unpaid care work for women and girls. We note, however, in our agendas, that little attention is paid to unpaid care work, and that labor participation continually, and as has been presented, has showed a skewed angle where women stands at a much lower rate. So we seek to really discuss and address this burden by measures that will free women so that they can gainfully employ in other sectors. Our project briefly, as we are going to seek to intervene to try out the best and effective intervention using what we call the power model, as you can see on the side there. This is a model that has been used in gender-based violence, but we would like to apply it to unpaid care work and assess which of the combinations of the power model and that can actually are needed to shift and address unpaid care work. It is an RCT project, and we have both qualitative and quantitative. We've just completed both the first phases of formative baseline, and we are moving into the interventions, which are going to follow the power model. And the power model has the 5 components. One of them is the economic empowerment for women and girls. And the second one, engaging men, as I've said, and boys, shifting the social norms and harnessing positive masculinity. And the third one, which is a W, is facilitate community engagement and dialogue and activism for action to shift and change unpaid care work. And E is to engage local level duty bearers and service providers, because these are critical in capacity building, but also in resourcing and accountability. And finally, the decision makers, that is the R. So our project is applying a combination of interventions to shift and change the narrative. This presentation, I'm going to focus on the formative study, which has been completed and disseminated, and focused mainly on understanding and mapping gender norms, which are associated with unpaid care work. There are 4 areas that we're looking at. We're looking at understanding what are they, because from the presentation, we know the burdens already, we know the time poverty, we know that women are burdened, but we really don't know the underlying issues that are responsible for the continuity and the unchanging nature of unpaid work. So we're looking at those social and gender norms, the descriptive and injunctive, that's what they do, but also what others expect them to do. We're also looking at the sanctions, rewards and punishments if you do not adhere to the descriptions of unpaid care work. We're looking at key influencers. These are the reference groups women and men look to in order to act or not to act, and the fear that comes in from the key influencers. And finally, we looked at the interventions and programs that are addressing unpaid care in the existing communities where we're working. And we used, those are the tools we used, and given the time, I will not go through all of them, but it was purely qualitative to try and understand the gender norms that are the drivers, that they're actually the seat, the foundation of unpaid care work. The key findings, we note, first of all, the issue of unpaid care. When you begin discussing with the communities, they start with a few words. In our culture, in our religion, in our community, in our family, in our clan, women do this. Men don't do housework. Women are supposed to do unpaid care. And you can see the mouth level where the unpaid care is being reinforced. So in our conclusion, we see that gender norms associated with unpaid care are closely linked to women's and men's identity. The ideal woman and the ideal man. Omukazi omutuufu, omusajja omutuufu. And this is so powerful for the communities, for women to be seen as proper or ideal, and men to be seen as ideal. We also noted that unpaid care work varies with different categories of women. We saw the women in the marketplace, we saw the women who are at home, we saw the women teachers, and so on. So that need to be taken into account. Thirdly, one of the key findings that we are getting is that unpaid care increasingly is being accommodated, especially by women who are working and generating income activities. That is a quote, a voice from one of the speakers, that, you know, when men participate in doing unpaid care work, most people in the community will say that they are bewitched and that their brains were converted. That is so powerful and put in a bottle. I just wanted to demonstrate the cultures, the norms that are associated on being norms or they are bewitched. So next slide, please. The other key finding, which we note, and I think which is so powerful, is the issue of the reference groups remains so powerful. The mother-in-laws, the men, the fellow men, the fellow women are so powerful. They say, I can't do this if other men see me, if other women see me. If there is a young boy who has married his wife and his parents find him, parents are a reference group, cooking, they might not be happy with it. To them, it seems like the wife is disrespectful and also the man is foolish. So there's also another component, the fear of indirect and direct sanctions. The men reported being shunned by fellow men if they were found doing work. The women too reported that if their home is untidy, they are not doing proper and work, they are shunned in groups, in associations. And we also noted mentioning why unpaid care is not shifting and is not changing. We also noted that there's limited shift, despite all the interventions and the talk we've had for years, there is minimal shifting in unpaid care work. And that is happening mainly in urban areas. But in urban areas, we find that they are the people who are now combining unpaid care and moving unpaid care work in workplaces. So instance, the market women will cook in the market and take the food cooked at home in the evening when they are going back. And interventions to address unpaid care are not well developed in all the communities that we visited. Next slide, please. So despite the fact that we talk about unpaid care, the interventions are limited. What are the key challenges? I would like to share with you just one big challenge. The deep-rooted gender norms that have normalized unpaid care are least understood and are just being accommodated and need to be carefully unpacked. And you can read that quote in later on that unpaid care is basically meant to be for women, and that persists all the time. Even for educated ones, they believe so. So, but the normalization actually is the key word that we need to unpack, and the nature of unpaid care work being accommodated also need to be understood. Next slide, please. What do we learn from here? What do we learn from our formative? That gender norms associated with unpaid care intersect deeply with women's and men's identity and have to be mapped and addressed with targeted interventions. They need to define the critical interests and reference groups around the 4R that have already been spelled out. The redistribution, the recognition, the representation, and reduction. We need to define the different interests around those areas. And thirdly, lastly, is that the discussion and engagement on unpaid care work has largely remained at family level. We get this from the discussions at the district level and with other key stakeholders who think that we are bringing household issues to the national table, and yet they are supposed to remain. And all of us in all the interventions seem to focus more at the household level. And we need to move and shift the gear to other levels. Lastly, opportunities for political policy action. I think we know that there are existing draft policies, for instance, in our country, and some which are under review that can be informed by the evidence that we are coming up in this research. And that we can really harness the growing interest of different governments and agencies to address unpaid care in the context of the public, of the pandemic of COVID. So there are opportunities that we can quickly harness and which can benefit from the evidence of the research that we are presenting. I think that is the last slide. So thank you very much for allowing us to share with you the few insights that are coming from our study. We are beginning to analyze the baseline data, and we hope that you can keep us in the Kenya We COP, as we are really enjoying already being part of you. Thank you.
Thank you. Thank you, Professor Kyomuhendo from Makerere University, for giving that context from the intergenerational identities to the other narratives that have existed for a long time that are hindering the economic empowerment and progress, and for presenting to us from Uganda. We appreciate your time. Thank you so much. I'd now like to go into the next phase of the presentation, and what's going to happen here is there are 3 speakers who are going to speak one after the other, and so we will allow them that chunk of time to give their presentations. But before that, we're going to have Dr. Patricia Kitsiao-Wepulo, who's the Associate Research Scientist from APHRC. Before then, we have the 3 presenters who will come in back to back, and then we'll come back to listen to presenters one after the other. So for Dr. Patricia, thank you so much. We welcome you to give your remarks.
Thank you so much, Janet, and good morning, good afternoon, wherever you're listening from. I work with the African Population and Health Research Center, and my main interest is in early childhood development. Right now, focusing more on how care practices can influence women's economic empowerment. So the project that I'm going to talk about is still in progress. We just finished the baseline data collection. And what we want to do through this project is to see how provision of quality childcare services can lead to women's economic empowerment. And that's the broad objective of the program. We are using a social franchising program that provides quality childcare services. This project is being carried out in Nakuru County, and we are building on an earlier project that was carried out in Korogocho, in one of Nairobi's informal settlements. So we just want to use the lessons from the earlier study that we carried out in Korogocho in this new program that we are working in. The specific objectives of the current project, we want to measure the effect of the model on women's labor outcomes, such as labor force participation and economic productivity. We also want to identify what works within the model and which aspects of the model could be scaled up. We also want to establish the cost and cost effectiveness of the model. because we know when we are suggesting or making suggestions for a program for scale up, usually the budget holders or the policy makers are usually interested in how much it costs, because this has implications on their budget. So that's one of the objectives that we're going to try and carry out through this project. The key challenges that have informed this project, we've seen that whereas we know that participation in the formal economy, and the previous presenters have already talked a lot about this, we know that participation in the formal economy is key to women's economic empowerment. Women remain poorly represented. We've seen examples from different parts of the world, including Uganda and Kenya. Women tend to be concentrated in lower grade jobs, so the ones that are not very prestigious, which means they have less control over their time. And this leads to the time poverty that has been spoken about earlier. It also means they have less control over the opportunities that they're able to take up in terms of labor participation, and also in terms of their mobility. They're not very flexible in the way they are able to manage their time around the work that they do. Professor Grace has already mentioned about gender norms. Unpaid care work is mainly viewed as women's responsibility. This again also leads to time poverty. And then there's a double burden that women carry. They are expected to contribute to the household economy, and at the same time, they are the ones expected to take care of all the tasks around the house that are unpaid. So you find that because of this double burden, then women are really being disadvantaged in terms of the contribution that they can make to the formal economy. And then because of the unequal responsibility that is placed on women for unpaid care work, we find that there's no equality. You see gender inequality in the way women are represented in different spheres and in different aspects of work. COVID-19 has unmasked very many issues that we have been trying to gloss over, to cover. And one of these is, we saw this in the way that COVID, when the first case was reported in Kenya in March 2020, the first action that was taken was the closure of schools. And childcare facilities were also closed as a result. And this led to diminished opportunities for women, because childcare facilities where they were leaving their children at, remain with the previous slide, please. The childcare facilities that they were leaving their children at were now closed. So it means that the burden of taking care of their children was left to them. They didn't have childcare facilities to take their children to. Next slide. So we see that from our past studies, some of the past studies that we've carried out, there have been several efforts to improve women's economic empowerment. And some of these have included expanding schooling opportunities, like affirmative action in school access so that more girls are able to join school, provision of loans, and then provision of financial literacy classes. However, these have not taken into account women's unpaid care responsibility. So you find that whereas these opportunities have been there, there is still the unpaid care responsibilities that are holding women back from taking full advantage of the opportunities that are presented to them. We found in our previous study, the one that was carried out in Korogocho, access to quality and affordable childcare services frees women to pursue paid labor opportunities. And some of the highlights from this project was that as a result of the provision of quality and affordable childcare services, women were 17% more likely to be employed. And the ones who are using the childcare services, they experienced less working hours without loss of earnings. So whereas they were working for fewer hours, they still were able to retain income levels at the same or at higher levels. For the current study, this model that we're going to test in Nakuru, it has worked very well in informal settlements in Nairobi. We need to test this model elsewhere, and especially to see what impact it has on women's economic empowerment. Next slide. What opportunities do we have for policy action from these studies that we've carried out, or the ones that are still ongoing? We need reforms in gender norms on unpaid care work. And I think this has been highlighted a lot in the previous presentations. We need more recognition of the importance of unpaid care work. And we know that the Kenya National Bureau of Statistics is currently undertaking a time use survey to identify the gender differences in time use patterns. I think that will go a long way in contributing to the formulation of the policy that is currently being worked on. And then we need government financial and resource support for childcare facilities so that this becomes like a public good. It's a public provision. If we have public provision of childcare, quality childcare services, then we are likely to see that it will be more available to more people. And we need the development of minimal standards for childcare centers and support to meet these standards. There is need to expand private sector action in providing childcare support for employees, especially those in the informal sector. And I think that is my last slide. Thank you all very much for listening. Thank you.
Thank you. Thank you so much for that, Dr. Patricia Wekulo, for that, again, insightful presentation and drawing a link between what we've just seen and heard from Professor Grace and a few of the other speakers, and really emphasizing the fact that the lens needs to be different. It needs to be a lot more holistic, a lot more, I think it needs to entail an understanding of the delicacies in trying to ensure that there is support given to women with regards to accessing economic empowerment. We're seeing how much it scales across the board. We're now moving into a presentation that will be carried out first by Ms. Lillian Kiruja, Principal Legal Officer, Tharaka Nithi County. Then that will be followed by Honorable Maruta Abraham Kirema, Public Service Admin and Devolution Affairs, Tharaka Nithi. And then finally by Professor Simon Onywere, Research Associate, KU WE Hub, the KU Women Economic Empowerment Hub. The three will be presenting one after the other and inviting each other to present before we come back to hear from Ms. Caroline Mutwiri, Dr. Mary Mbithi, and then going into the panel discussion. I am also cognizant that time is running quite a fair bit, and so I'll urge our speakers to just try and stick within the timeframes, even though we could discuss this at length, because you are all raising such critical, rich, and important points. Thank you very much. At this point, I'd like to now invite Ms. Lillian Kiruja. Where you are, it's a bit dark, Ms. Lillian, if you're able to move where there's a bit of light, if that's okay with you, or even if, you know, the options again for our speakers, whatever you're comfortable with regards to being on camera or off camera. For now, let us invite the three speakers. I will interject only where there is need to. Karibu sana, Lillian. We look forward to hearing your presentation.
Thank you very much. My name is Lillian Kiruja, the principal investigator in our project. The principal investigator in the Tharaka Nithi County research projects, where we have about 30 researchers. Kindly put on the slide. So our projects, it looks at enhancing women labor force participation and child development through a creche program. And out of our research focuses on 3 components which are interrelated. And the first one is women livelihoods. We are also looking at female labor force participation and the impact of the creche on the women, on the female labor force participation and development of child psychosocial well-being. Next slide, please. So the background of our study, we were looking at we did a pilot, which was to look at the women's livelihoods. On the pilots, we carried pilots in 2 areas, which is the upper zone of the Tharaka Nithi County and the lower zone. And the survey was carried out between 13th September and 1st October, and we also had a few stakeholders meeting, which were aimed at informing our range of our survey and pilot projects. Basically, The focus of our study was to look at the unpaid work in Tharaka Nithi County being done by women, and childcare work in the county is strongly linked to livelihood activities of women in Tharaka Nithi, and therefore our study mainly sought to answer the following questions. How is women's livelihood distributed in Tharaka Nithi, and what role does the child care play in the livelihoods and female forced labor participation? That's what our research was looking at, and the survey results of our pilot study as follows. Next slide, please. So our pilot study was looking at two areas where the first study was looking at the upper economic zone, where it's like the islands of the county, and the lower side of the county. So the upper side of the county, we saw the study established that women in those areas participate in daily farming. Like you can see, there is zero grazing. There is also some element of tourism, which is because it's the upper side of Mount Kenya. And also there is a lot of tea farming. And also when we looked at the marketplace of where women participate in the upper zone, they're quite very modern. Like you can see in the slide, we have the Chuka modern market, as contrasted to the lower side, where the economic activities are a bit low on women. Like you can see the marketplace where women go in the lower side, it's called Gatunga Market. We have women, if you contrast the Chuka and Gatunga markets, they are quite different, depleting the livelihood of women in Gatunga and Chuka markets. You also see that women go to fetch water in wells and sand dams on the lower side of the county where we did our pilot study, and they are forced to go with their children because of the unpaid care. We also see the farms the economic activity which is depleted in the lower side of our study mostly is plowing of maize and sorghum, and the area is quite dry, as can be shown in the photos. And also, unlike the upper zone where they concentrate on daily farming and zero grazing, you see women on the lower side are forced, usually their lively activities includes taking the grazing of livestock, and they are also accompanied by their kids when they are doing these economic activities, as you can see on the left-hand side of the slide. We move on to the next slide. So in order for us to bring out the differences of the studies in the areas where we studied, the first pilot was done in Modambe ward, which is in the upper side of the county, and the Gatunga ward, which is in the lower side. For the Modambe site, the rainfall, the weather, the climatic conditions are a bit favorable for farming, especially because the amount of rainfall which is received in those areas is quite high, and the land is it's highlands, which is very productive because it consists of red volcano soils, and there's a lot of adequate rainfall in these areas. So we have economic activities which women engage in these areas include tea farming, coffee, growing of coffee, bananas, maize, and legumes, and they do quite well. And the small lands per capita in these areas, of course, force people to move to the lower lands of the county or invade the forest which is near them because of the high population density in these areas, especially because people look for housing or a provision of housing because of the population. But in the upper side, our study shows that there is better access to schools, which makes the economic activities there a bit more valuable to women, because most women have access to school and they attend schools. On the contrast, when we did our pilot on the lower side of the county, we found that in Katonga ward, we found that rainfall in these areas were less than 500 millimeters, and agriculture yields there are relatively low. So women and persons in these areas are forced to invest in sorghum, millet farming, and grain grams or cowpeas, which forces them now to greatly rely on pastoralism or casual labors in the market centers, or farm in other people's farms during growing season, so that they can get something to put on their table. What are the activities which they do when they go to do such activities? You find that they're involved in the slash, burn, or remove plant, or movement is common, and this has greatly aggravated soil erosion and water scarcity in these areas. And the soil level shows shallow soil vary in pH because of the acidity. Let's move to the next slide, please. So what were the survey results from the pilot studies we carried in the two areas? We found that women spend an average of 5 to 6 hours of unpaid work per day, which varies from 1 hour to 15 hours respectively. And we've also found that portion of the money controlled by women is determined by if they work or not. So if you do not go and work, you don't control the income or resources of that particular household. And also there was a finding that ownership and control of land and assets is mainly vested in men in the two areas of our pilot study. Also, there was a finding that married women participate less in unpaid work compared to those single women who are raising their children in a single household where there is no male figure. It was also established that hours of work spent on taking care of women spent on taking care of their children per day range between 8 hours to 19 hours, varying between 1 hour or the same 19 hours per day. This is data which was collected by our study. From this pilot survey, the team intends to have a policy dialogue with a policy committee to dispense our findings. They also propose to have a CRESHE program implementation technical committee, which will support this implementation of these findings disseminated from our research. And also we are proposing a support structure in the counties or on the ground, which shall comprise of the cabinet, of the county executive committee member, colloquially known as the cabinets. And then we also we have a proposal to loop on the county assembly, which is the legislative arm of the county governments. We also propose that the technical committees, both of the national and the county departmental heads, should be involved so that all these policies are adopted as per the provisions of the Constitution. And also we are proposing that once these findings are piloted in the counties, they can be upscaled to be adopted by the national government ministries and the entire 47 counties through the Council of Governors caucus. Next slide. Thank you. So the next presenter is Christopher Kiboro on behalf of Honorable Maruta, who is not present, but has given his apology and has dedicated the presentation to a co-researcher. Thank you.
Thank you, Lillian. Greetings to everybody. I'm going to step in on behalf of Honorable Marota and make a presentation on the other part. And I would request the one who is projecting the slides to project for me, please. Kindly, the one who's projecting the slides. Thank you very much. So this study, as you have heard from Lillian, they are quite interrelated. And for this reason, we did the pilot survey more or less the same time, that is the month of September and October. And these surveys were informed by stakeholders meetings that were held in Tharaka Nithi County. And the surveys were done to answer a wide range of questions on livelihoods and child care. And my concern, because these questions have already been asked or rather presented by Lillian, my focus would be on impacts of creche on female labor force participation, and therefore just go directly to the survey results. Next, please. So for this particular survey, we did the pilot in 3 wards, that is Modambe ward, Chakariga ward, and Gatonga ward, as you can see in that slide that is projected. Next, please. Next. Yeah, my focus is more on the creches or the child care centers. As you can see from these photographs, these are some of the photos that we took during the pilot study to demonstrate or illustrate the situation out there. On your left, you can see these are children who are enjoying their meals, and on the right, you can see these are children who are in the classroom. And down there, you can see that's a kitchen. And on the right at the bottom, these are children who are napping, they are sleeping. And what these photos demonstrate is that, or rather what we just wanted to know is to understand the situation on the ground so that as we proceed with our project, we are able to determine what are the needs or what is existing out there that would inform the design of the creches for these kids. And as you can see, especially from the photograph right at the bottom there, you can see those children are napping on top of their desks. Next, please. So these are some of the preliminary findings that women in upper zone spend less time with their children than those in lower zone. And we also found that use of daycare center increases women's participation in wage employment. Also, women with total control of their income are able to participate more in wage employment than those with partial or no control. And this can be explained that if someone has control of income, they are more motivated. It's an incentive for them to go out there and participate more in wage employment. The other finding that we're able to come up with was that giving all women total control of income will increase their total female labor participation by at most 23%. And what this implies is that there are other factors that are at play. But generally, this is what we found, that by giving women total control of income, that in itself will increase their total female participation in the labor force. We also found out that women tend to work on wage jobs which are near their homes, and this is attributed to the domestic care responsibility that they have, which do not allow them to out-migrate and take advantage of the opportunities that are far away from their homes. Mothers who cared for their children at home also reported that their children enjoyed better health compared to those mothers whose children were in ECDE or informal daycare centers. The other finding that we came up with from the pilot data was that many informal daycare centers and creches do not have playground or children's sleeping places during the day, as it has been demonstrated in the photo that was projected. Also, women are willing to use creches which are within their reach, preferably not more than 3 kilometers from their homes. So which means, therefore, even as we design these creches, then distance can be a cost that to women and can be a deterrent or something that will not quite motivate them to take their children to creches. Next, please. Now, as we were doing the pilot survey, we came across a number of issues that are of interest to researchers and also to policymakers. And these are issues that led the team to come up with what we are calling one-page policy briefs, and they are based on compelling evidence that we're able to observe in the field. For example, we found that in some markets, like the Tonga market in Tharaka North, there's intrusion of livestock within the market, which end up destroying the merchandise of those women who are training there. We also found that there's need to upscale. There's need for a policy brief or rather policy intervention to upscale COVID-19 vaccination, where we established that in some villages, the uptake of the COVID-19 vaccine was very low. Also, as we were doing our research, we came across teenage mothers who are in need of being rescued and rehabilitated because some of them are in informal settlement in very deplorable conditions. Also, there's need for school feeding program. This would retain children and also encourage more to join the school. There's also need for policy to address the negligence of men and boys in the development agenda, especially within Gatunga ward. There's also need for provision of mattresses to ECD centers in Tharaka Nithi County. And the creches in ECD centers, there's need for a new regulation that is needed because quite a number of them are not regulated, or rather we need to have a framework, a policy framework or legal framework to regulate these creches so that the safety of children and the quality of these creches is enhanced. Then the provision of quality child care services to all children is an issue that needs to be addressed because it goes a long way in alleviating or creating time for mothers to engage in wage employment. Then we realized, as you have seen even from the photos, there's need to protect water sources. As you have seen in one of the seasonal rivers, women there trying to dig wells. And then the farming practices, land management and women's livelihoods, these are interlinked, and therefore there's need to have a policy that will ensure that the farmers engage in appropriate farming practices that will take care of the environment. The policy dialogue, again, just as the principal investigator, Lydian has explained, these are the key stakeholders that we think ought to be involved in the policy dialogue. This includes the policy committee, the pressure program implementation technical committee, also other supporting structures on the ground, which should include the county executive committee members, then county technical committee, which includes the national government and the departmental ends. Within the county, talking about the county commissioner, we have the national government for 7 county governments, council of governors. This would actually constitute what we are calling the policy dialogue committee. Thank you very much.
Okay, Simon, we are here. Are you able to see my screen? Okay. Are you able to see my screen?
Yes, we can.
Yes, yes.
Okay, thank you. I'm presenting on behalf of the Tharaka Nithi County team under the Kenyatta University we have, and I'm in particular focusing on female labor force participation which is one of the 3 interrelated studies. Within the project of Tharaka Nithi, we have 3 interrelated studies. One speaks to the other, and the other cannot be without the other one. So livelihoods, female labor participation, and the child development have an influence on one another. And as you have already seen, Tharaka Nithi has a number of activities, livelihood activities, mainly women are involved in them, including the grazing of livestock, especially in the lower areas of the county. As a background, the way we designed the project was to have meetings, stakeholder meetings, which we held one with the technical team at Tharaka Nithi County itself, and discuss the project, and then we're able to agree on how we were going to approach our implementation of the 3 themes within our project. In particular, the study was implemented between the 13th and the 1st of October, and it involved doing the survey for rapid livelihoods, rapid survey, and rapid needs assessment, as it were. Here you see one of the photos, some of the researchers were in the field, how we conducted this business, and without the help of the community health frontiers, maybe this would not have been possible. In the data collection process, and as I've alluded to, here presented behind you is a map. And basically, this map gives you an orientation of where we went. And you'll see as I go through these different possibilities within the county. This is a Chuka market there. But if I click the first one is where we held our meeting with the county government people. And then we went into a stakeholder meeting, another period of time. And as you can see here, we met the stakeholders, specifically also within the field areas themselves, where we went into three different sub-counties in the Tharaka Nithi County. We had also female labor force participation on the markets. Just to give you the context is to just understand that most of the livelihood activities of rural women or rural communities cannot be without opportunities in the markets. So the markets play a significant role in terms of that possibilities. We also have issues of what type of livelihoods are there. We have basically high production livelihoods in the upland, in the upper parts of the county. And then we have these lower parts of the county where basically the livelihood strategies are based on dryland farming and also livestock keeping, mainly of the goat type. And then of course, our main interest was the creche needs that these people may be having, especially in relationship to whether they have the facilities. They do have one facility at the Chuka, which is going to be some kind of example of what can be delivered by the creche. And as you can see in that particular presentation. Sorry, close on that, then move on to the next slide. Yeah, so the surveys were conducted to answer a wide range of livelihood and childcare questions, and our sample size varied from 315 after analysis. Of course, there were some questions which were not answered. We had a sample size of 450, but we return a record of anything between 315 and 418, which is not bad. And then we had some survey results, and this survey result is focused on unpaid care work. And as you can see in this slide, childcare work in the county is strongly linked to women livelihood activities. And the fact that women livelihoods are distributed across all agroecological zones in different ways. So you can't have one model for enabling the women to deliver their livelihood activities. And we then asked the two questions. main questions. What role does child care play in the livelihoods and female labor force activities? And how is the national labor force participation affected by COVID, especially when we look at it in relationship to females and the males in the county. As part of the results, we actually use a panel data that is available, as you can see in this slide here, from a number of institutions. We utilize that data to actually map the spread of COVID and how this is reflected in the county. And as you can see in this map of Kenya, where the darkest area is basically where the population is most affected in terms of COVID. And you can see that it is actually along the main road, along the main artery road of the country. And that means that this is where labor work is. This is where the work for women or the work for people generally is, along the main transport routes. If you go to the north, you'll also see that it is also along the main transport route. And our concern then was, and we from the interpretation we made, is that infections and vulnerabilities to COVID are high along the major road, and that Nairobi is affected most because of course, all the roads converge to Nairobi at the end of the day. And that Mombasa is also a convergence zone, mainly because they are ports of entry. And the key drivers of COVID spread was actually the commercial vehicular movements on the major road. And one finding or one interpretation we make is that the labor force participation on the road is mainly on the roads corridor. It's a significant finding, and therefore it can influence the way we utilize or institute measures to address COVID. And then COVID infections and the vulnerabilities to COVID also reduce labor force participation a lot. And this was more so for men. And the reason for men is that the men are willing to take a risk, so they will just go to work even if they knew that there was a problem, that it affected women. And but we also, from our interpretation, was that women's participation was reduced more by COVID-19 vulnerabilities, in which case when the women knew that there is a problem somewhere related to COVID, they did not take the risk to go and participate. And then of course, lockdowns and curfews reduce labor force participation for both women and men. And this is a very well-known effect or impact. There is additional results, and you can see here what women are doing. Even the selling of the goats themselves is actually an activity practiced by women, especially in the Tharaka Nithi County part of the area. And you can see we utilize the panel data, the paper which has been published by MADA and others, and in which case where the team from Tharaka Nithi is involved jointly with Kenya National Bureau of Statistics, and of course the Tharaka Nithi researchers in understanding this dynamic, but we approach it from the country perspective before going on to then localizing. The evidence for uptake and this utilization, we have already seen this is the issues of policy dialogue. Using this evidence, we know that we will need county policy committees to help in utilizing the evidence, especially the policies that the one-pager policies that we have proposed, 10 of them, and that the CRECHE program implementation technical committee is a key component. And of course, all the structures of the county will be necessary in uptaking the evidence for this particular research of Tharaka Nithi, as well as then using the county governance system to provide an uptake towards to the national government, and also the 47 counties through the Council of Governors. That's all we had for you today from KU. We have this mode of presenting research called the story map. It's an interesting mode of presenting this. And because of technology, I was not able to show you various opportunities that are available. because this was we were not able to illustrate to you the possibilities with the expansions of the maps. Thank you very much.
Thank you so much for your presentation. I apologize for interjecting there. In the interest of time, thank you to all of you for painting that picture in Tharaka Nithi as a key example in a lot of the work and information that has come up. Allow me at this point to move on to our next presenter, who is Ms. Caroline Mutwiri, gender statistician, Kenya National Bureau of Statistics, before we have Dr. Mary Mbithi, all of whom I will urge kindly to just try and keep your presentations succinct to allow us more time as we approach the panel. So, of course, Ms. Caroline Mutwiri, welcome. We look forward to hearing from you. Thank you.
All right. Okay. Thank you, Janet, for the introduction. Good morning, good afternoon, and good evening, everyone from wherever you're joining us from. I hope I'm audible enough, and I'll also try to keep it to my 5 minutes. So a quick one. KNBS is basically the principal agency of the government for collecting, analyzing, and disseminating of statistical data, as well as the custodian of official statistics. In regards to today's topic, for us is to basically ensure that quality statistics on unpaid work are provided to inform evidence-based decision-making. And unpaid work is best measured through a time use survey, which essentially just measures quantitatively how people allocate, spend, and use their time among different types of activities during the day. Right now, we are actually undertaking a time use survey for the first time, a national one, through the KNBS, and thanks to UN Women through the Women Count program and other key stakeholders for this milestone. So a quick one on the objectives of the survey. It's just basically to just identify any gender differences on how people allocate their time, with a special focus on paid and unpaid work activities. Another objective is just to inform policies and resources allocation to programs that are meant to accelerate gender equality and women empowerment. And such kind of these policies include family and childcare policies, unpaid work policies, social protection policies, among others. Additionally, the survey is meant to also improve on the compilation of the contribution of household production to the national accounts. What happens is most of the national account income and product accounts, they majorly exclusively measure only market production and do not take into account goods and services that are household produced, basically for their own private consumption or for any household production that is not traded in the formal market, but it's consumed by others. Another one is just to monitor the progress that is made to some of the commitments, e.g. the SDG indicator 5.4.1. So a quick one on the survey methodology. As I said, we are currently conducting the survey, a cross-sectional type of a survey with a sample size of 24,000 households. And it is not a standalone survey, it is a module on an ongoing Kenya Continuous Household Survey. Reference period for this one is last 24 hours. So individuals are filling in the questionnaire using or basically on what they were doing on the previous day, the last 24 hours, within a time interval of 1 hour with on a maximum of 3 activities for the 3 hours. And how we are categorizing these activities, we are using what we call the International Classification of Activities for Time Use Statistics, 2016 one, that enables us to collect, to classify the activities in a meaningful manner for comparable statistics across countries, which has 9 major divisions. And for the unpaid work, it's on division 3, and also on major division 4 and 5 as well. 3 is on unpaid domestic work, 4 on unpaid caregiving work, and 5 is on unpaid volunteer and trainee work. Done through CAPI methodology, the computer-aided personal interviews, where you use a tablet or a phone to collect the data. The respondents for the survey, 2 per household, 15 years of age, and they are randomly selected through the system, the CAPI system in the Kish grid. Next slide. Sorry, next slide, please. So the questionnaire has several questions, and as you can see from the slide, we are collecting info on what the day of the week is, the time period, through the time intervals, the 1 hour interval, 45, 5 to 6, so on and so forth, up to 24-hour looping. And then thereafter, activities are described, and the ICATAS 2016 is used to code the specific activity. So we have a description and then a code for the activities, and the duration of that activity, which is supposed to be in minutes. And then we also have a series of questions that are contextual variables, which are just essentially physical, psychological, social, and temporary features of the environment in which the activity is taking place. In this case, we have 4 of them: for whom the activity was done, whether the activity was for payment or for profit, with whom, or basically who was with you, and then the location on where the activity took place. We have also some questions on whether that was a typical day for you, the reference day actually. Maybe to just try and explain some of the outliers on probably once we get the data, and whether the individual enjoyed any activity and they're supposed to code which activity they enjoyed. So we have a series of questions, 18 statements actually, that are supposed to measure the perception towards gender equality. And how this is done is by answering using a 5-point Likert scale, whether you agree or disagree with several statements. So in a nutshell, that is what the questionnaire is collecting. Next slide. So some of the key gaps or challenges: financial resources. We all know data collection is very expensive, but thankfully, again, I said UN Women and other key stakeholders were able to do this. We are in the processes of implementing the survey, which is done, as I mentioned, again, on quarterly basis. And we're supposed to complete data collection on Q4 for 2021. Which started on Q1 for 2021. So we are going to capture all these different seasonalities or different patterns of time use for the entire year, which is good for us to see whether there are any differentials when you look at the different data points. And the other technical gap is in terms of technical capacity, in terms of measuring and analyzing the data. So as we all know, this is the first time a national survey of this magnitude is done in the country. But again, we got some support from the UN Women, and we were able also to learn from our neighboring countries like Uganda, who had done their survey. So we actually borrowed some best practices from them. Coordination and collaboration is also a little bit of a challenge, but thankfully the gender machinery, the State Department for Gender, and also the ICRW, specifically on what they're currently doing in efforts to ensure active collaboration from both the state and non-state actors. And as well as also the pandemic. Previous presenters have alluded that the pandemic has been an issue, and for us, it's also interfered with the implementation of the survey, which was basically just delayed. But lastly, opportunities for policy action. So time use statistics can be used to inform a lot of policy or programs as well. So first one, the national accounts. The national economic accounts, as I mentioned earlier, what the issue was, and this is meant to just enhance the coverage of national income and products accounts, which basically just measures the economic activity for the nation. And our goal here is to provide data that will be able to have the national income and product accounts comprehensively tabulating all economic activity in the nation. Another example would be on child and family care. We all know a very key component in time use statistics is the element of unpaid work. Basically just caring for others, for example, caring for children, elderly, sick individuals, persons with severe disability. And this one depends on the time they involve themselves in other productive work. Social welfare issues such as social protection are very critical in enhancing capacity and opportunities for the poor and vulnerable persons. Meant to just sustain their livelihoods and welfare. So this is supposed to relieve the burden and allows the individuals to engage in other formal or market productive work. We also have issues of labor and employment related policies on how to improve measures on how time is spent at work or while working for the pay, and also to understand the effects of the public policy. Also to improve the productivity measures, the transitions from work to unemployment, retirement, maternity leave issues, paternity leave, overtime, overworking. I mean, this can be addressed through data from time use. And then key for us as well is unpaid care and domestic work policies, which is currently ongoing through the State Department for Gender. So I hope I'm kept to my time. So thank you so much for that. That's the end.
Thank you, Caroline. Yes, you did. And once again, highlighted critical points towards the end there, speaking to the transitions and how those can also be included in a lot of this data that is being gathered and the evidence being presented. So thank you very much for your presentation. We appreciate that. And we'd like to now move on to our last presenter for today's session before we move into an engaging panel discussion. Dr. Mary Mbithi, Senior Lecturer, School of Economics and Director of Research, Women's Economic Empowerment, or WE Hub, University of Nairobi, Kenya, to also deliver her remarks today. Thank you very much and welcome.
Thank you very much, Janet. The person showing the slides, please. Yes, thank you. So briefly, I'm going to tell you what the Women's Economic Empowerment Hub at the University of Nairobi is doing with regards to unpaid care work. We have 3 projects which are interconnected. The first one is on enhancing participation of women in cross-border trade through access to childcare facility. And in these projects, the main, the main motivation is because there are many trading opportunities that are coming up with within regional trading arrangements, including East African Community, COMESA, and now the African Continental Free Trade Area. And all these opportunities present an opportunity for inclusiveness of women in economic empowerment, as well as to contribute to economic development. But we also know that one of the challenges that impact on women is reducing their participation is the issue related to unpaid childcare work burden, which we know we have had many times is really women that tend to take care of those activities. We also realize that in cross-border areas where this kind of activity is taking place, cross-border trade, there is limited access to childcare facilities. So those are the key motivations to this particular project. The objective of this project is to enhance access to childcare facility for cross-border women traders in Kenya. And of course, the information we collect, we want to use it to advocate for enhanced access to facilities for childcare in other regions in the country. We also want to increase awareness on the importance of change of gender norms when it comes to childcare in related activities. And also we want to contribute to increased income for women traders for their economic empowerment, as well as increased participation of women in cross-border trade, as well as in other areas of the economy. The next slide, please. Okay, so the key gaps that we have identified is, limited access or limited availability of childcare facilities, especially at the cross-border trade. The main area of our study, we've looked at Busia County, Busia cross-border trade, and we've also looked at Namanga, the cross-border trade, the border between Kenya and Tanzania. And we have also looked at the other challenge is the inadequate budgetary allocation to support childcare, as well as early child development and education. So we've collected both quantitative and qualitative data to form the baseline for our study. So we've already completed that, and right now we are analyzing the data. So very soon we are going to have very comprehensive story related to what is happening at the borders and to do with the simplified trade regime and other trade policies that are being implemented to facilitate trade along the borders. So one of the things, some of the early learnings that we have from this program is that women have not benefited much from the simplified trade regime, one of the key trading arrangements being implemented at the borders because of key challenges, and women have continued to remain in the informal trade, using the Fanya routes to do their business, even though there is a clear free trade area arrangement. Women also are involved in cross-border trade. Women who are involved in cross-border trade have identified themselves the need for a childcare facility at the borders. And again, what we've done from this point is together with our partners, the Collaborative Center for Gender and Development Studies, a civil society organization, and I think they are represented here. We have started a childcare facility at the border of Busia, and we are thinking of a second one in Namanga, because that's where we want to carry out our investigations. And we started with 55 children about 3 months ago. And now as we talk, 3 months later, we have 85 children. And these children are not only for the women that are involved in cross-border trade, but also the ones that work in the offices around Busia, at that point, Busia town. So that speaks to the need for a childcare facility that is easily affordable and which can easily be reached by both those that are employed as well as those that are in business. Ministry of East African Community is also considering including a childcare facility within the modern market, which is in the planning for construction at the Busia border. And actually, let me mention that Ministry of East African Community is also one of the key partners in implementation of this particular project that we have. The WeHub has also developed indicators to monitor the effect of childcare facilities on women participation in cross-border trade and on the growth of their businesses. Early indications that, women have more time. They are saving time, they can spend more time in business, but we also want to monitor that for a period of 3 years, and we'll be able to know the impact that the childcare facility, when women can access it, what it means for the growth of their businesses. Now, areas or opportunities for action. Opportunities for action exist, for example, in establishing affordable childcare facilities, not only in cross-border areas, but or areas of the border points, but in many areas. But our study for now, we are concentrating in the border areas, but opportunities exist for both private sector, for public sector, and even as a business, supplying affordable childcare facilities, which are of good quality. There's also need to examine policy and budget allocations to sectors that affect women and childcare. And based on that, then what we've done is we have moved to our next part of the project where we want to look at budget, because we have seen there's need for government, both at the central government and the county governments, to take into account the issue of childcare facility. There's also need to advocate for increased budgetary allocations to childcare and early childhood development and education. And also there's need for policy for childcare facilities on cross-border points and even beyond, even in the marketplace, to support women that are involved in business in general. The next slide, please. Can I have the next slide? Okay, related to that project is also the project that we are evaluating, the annual budget statement and its implication on allocation of resources that are related to sectors that support childcare and women's work. And with this project, what we've done is we have analyzed the annual national budget policy statement for the year 2021-2022. We have looked at the allocations that the government is proposing for different sectors. More specifically, we've looked at the sector of water and sanitation, social security, health, education, and food security. And the other thing that the Hub is doing is we have analyzed this and produced a policy brief that we are using with our partners, to highlight key areas where we think government could increase their allocations so that it can support more work that is related to childcare and which negatively impacts on women's participation because of the burden that it has on women. So the Hub is also participating in public hearings that have been going on for the national budget, and it has submitted recommendations with regards to budget allocation in those key areas. We are working with several partners in this. We are working with the Collaborative Center for Gender and Development. We are working with the Crown Trust. We are working with TechnoServe and also with Oxfam. The objective is to contribute to gender-aware budgeting in Kenya, and also to contribute to enhance the budget allocation to the areas related to women's work and the care economy, including water, health, social security, education and food security. And also we are targeting to influence 2022-2023 budget allocations so that much more allocations go into those 5 sectors, both at the county level as well as the national level. The key gaps is that our analysis showed there is really those key sectors which relate to women's work and childcare. The allocation is quite really very small. And we also realized a lot of information is lacking to support the general assertions that are made related to economic status of women, and especially when it comes to the care economy. And we also realized there are complexities for ordinary persons in undertaking of the technicalities of making of the national budget, which makes it difficult for them to engage in various points allocated to public participation in budget making process. Because if we expect women groups, for example, or those women that are involved in cross-border trade to contribute to the county budget, for example, we realize the language is too technical, is complicated, and the budgeting process, even if they would like to participate, they are limited. So those are some of the key challenges we found. Key learnings is that there is need for capacity building to different groups that are involved in, that want to be involved in budget participation in the budget making process through the calls for public participation. Also, there is need to work together and stay together. And that means the organizations that are working in the areas that are supporting the women's economic empowerment and the care economy, they need to stay, connected, and so that they can bargain better for the support and allocation of the budget in those specific areas. And also we realized information and data are very important when it comes to influencing policies, allocations, government allocations to the childcare related work, whether we are talking about the county level or we are talking about the national level. The opportunities for action, we realized there is need for making we issues and the care economy a substantive item in the social protection sector of the national and the county budgets. And this basically means specific attention is paid to the said issues for budgetary allocation perspective, research and monitoring. And based on this, we are also looking at the county level. We are going beyond the national level and looking at what proposals the counties are making.
Sorry, you have 1 more minute, Dr. Mbithi, 1 more minute. Thank you.
That account. Let me have the last slide. The last slide, please. Can I? Okay. The last slide is the last slide, please. Okay. Based on those based on that work, we've also looked at the proposed bill on breastfeeding policies, and we've made our recommendations on the need to have lactation rooms and baby care rooms to be included in that bill in different markets or different areas, even in workplace, so that it reduces the burden related to childcare. Thank you very much.
Thank you so much, Dr. Mbithi. Critical points there. That last part was very relatable around the lactation rooms, breastfeeding rooms, which I think very many women across the country can speak to in terms of just being able to access those to further be able to participate in opportunities. I'd now like to invite our panelists. We're going to have a conversation, and as I invite them, I'd also like to remind us all that there are questions in the chat box. We might not, in the interest of time, be able to reply to them, and so perhaps the speakers and panelists in between now can engage people in the chat box to try and answer some questions that have come up. So continue to share that. So I'd first like to invite Ms. Anzetse Were, Senior Economist, FSD Kenya. I'll invite her to switch on her camera, and I'll also invite Ms. Frida Gibuko, Executive Director of Kenya as well, to switch on her camera. Dr. Wangila Fanis Feather, Director, Gender and Development and Senior Lecturer, Analytical Chemistry, University of Kabianga. I'd also like to invite her. And finally, Dr. Carol Ajema, Senior Gender and GBV Specialist, ICRW Africa. Ladies, I hope you're all keeping very well. Thank you so much for staying on. And I'm sure, just as I feel, the presentations have been so rich and insightful. I'll start with you, Anzetse. You know, sometimes I think we hear terms like from me, who's a content creator and storyteller, it's how do you dissect it to be very accessible and understandable. And the more we hear these presentations, the more you realize, yes, it's about looking at the low-hanging fruits and finding a way to have those be sustainable and inclusive to economic empowerment. So with that said, what do you think are the economic impacts of unpaid care work in Kenya, and why does it matter?
Thank you, and thank you very much to all the previous presentations. I'm really glad we got copies because I think there's a lot of granular content that will certainly inform our work. So I think just to be quick, because I do know it's been a long session, if you look at the way the economy is structured, there are really three main layers, and the unpaid care issue goes through all of their layers. So I think most of the conversation today has really focused at the household level. That's at the microeconomic level, which is really looking at the day-to-day tasks of maintaining a home, particularly the labor and intellectual bandwidth required to raise children, and the effects of pregnancy in the domestic space, and also just the difficulty, you know, if you do have a job, or if you do have work outside the home, the difficulty of being productive. So I think the bulk of the conversation has been at the micro level, so I won't belabor that. I think what we also see is that if you're looking at the middle layer of the economy, so this is really looking at where women earn a living, whether this is at the firm level, whether this is at self-employed or in in office spaces like many of the women here. What we're finding is that the unpaid care reality has a dual effect in that space, in this middle layer of the economy. First of all, at work itself, I think because of the domestic responsibilities that women do have, the emotional labor, you know, in attending to the domestic space issues, means that often the responsibilities at the firm level or at your employment often are compromised by that. Women cannot stay very long or very late, even if they're important meetings. You know, the typical thing of if you have a job that requires a lot of travel, a lot of women will forego that. You know, I certainly did earlier on when my daughter was young. But also at work itself, you'll find that women are expected to do additional tasks in the workplace beyond the roles that they have. So if you're looking at the emotional labor in meetings, or, you know, taking notes, you know, that's not really your job, but suddenly you're the one doing it. Often that's women. Or, you know, organizing voluntary events for the office. Again, that tends to be the women who do that. And certainly just being the donkey of the office. So if there's extra work to do, there's an expectation that the women are going to be the ones to do it. So as a result, even in this middle layer of the productive layer of the economy, how women are earning an income, you find that this expectation of women continuing to play this role of unpaid care or unpaid labor, it just continues into that. So what this shows up at the macroeconomic level, now you're looking at any economy-wide situation, this has already been alluded to. The first is that there's a gross understatement of the economic contribution of women, just a massive understatement. This goes beyond the gender wage pay gap, which is already an undercompensation of women. But beyond that, this unpaid care issue and the inability or the lack of our history in tracking it means there's a gross understatement there. The other big thing is that there's this massive and continued non-compensation of women for the aggregate contributions that we make to society, whether it's our labor, our skill, our time, our energy. It's not quantified, it's not compensated, and therefore it's invisibilized. You know, and then certainly the real effect is that the unpaid labor, emotion, skill, capabilities of women is basically bankrolling the societal and economic welfare of societies. Without the unpaid care of women, the societies that we live in would be a lot more bankrupt and a lot more broken than they are now. And so the effect is that our unpaid labor is bankrolling the welfare of society. And the cherry on the cake is that we don't get any power dividend, right? It's not like we're being compensated by being brought to the table or because of all these things. So in addition to this, now the effects of this massive sort of triple layer of unpaid labor means that from an economic point of view, often women are seen to be less economically efficient, because we're doing these multiple tasks and we're having to be actually very efficient in how we spend our time. Because this has a knock-on effect in our ability to be productive in the workspace, the narrative becomes women are not as economically efficient as men. Of course, women are not compensated as well because there's this perception that somehow men get things done better. Women are obviously financially dependent. When you're doing a lot of unpaid care, you're going to be financially dependent because that is not that you do not have the means of then earning a living within that time frame that you had. Women are also expected to compromise our career goals. We're expected to compromise our economic goals because that is your role as a woman. So what does that mean in terms of our financial autonomy? And often the career trajectory of women and therefore their future income earning potential is interrupted by this continued expectation that you're just going to be providing unpaid care for the rest of your life. As a result, it's the same old thing. We see fewer women in positions of leadership. And I think we've already seen the issues on the broad mental and emotional strain. So what we're saying is that not only is that compounding at each layer, those then aggregate to an ecosystem that makes it very difficult, for women to be, the role of women to be really recognized comprehensively.
Thank you. Thank you so much for that. We'll see, and let's say if there's any time or point in which we're able to come back. You've covered some pretty great ground. I actually want to move to Dr. Fannis Wangila. There's something, Anzetse has talked about these gender dynamics and impacts of unpaid care and domestic work in Kenya. I also like how she's included just the different layers in terms of whether it's women in employment and how much that's often compromised. She spoke to it. I certainly can. So I think it's very relatable on so many levels. And so, Dr. Fannis, what measures and approaches should be put in place to achieve economic justice and access to decent work for women over and above what we've heard today? What else would you recommend?
Yeah, thank you, Janet. I appreciate the comments that have come across from various speakers, and definitely it's quite informative. When you look at all these things, one thing cuts across all border, the socioeconomic, the socio-cultural impact. And of course, this will definitely cut across the government, input as far as this particular aspect is concerned, because then this is one of the inadequacies that we have, which is infringing on women as far as empowerment is concerned. So one thing is very true, the cultural impact. How do we deal with it? And if we can be able to deal with it, just like the government has done with the FGM, it has actually helped girls go to school. And when they go to school, definitely there's productivity. Definitely we are actually reducing the aspect of unpaid care. We are reducing the aspect of domestic care. And again, the other thing, apart from the socioeconomic aspect, we also have what do we call this? The demographic aspect. Different regions experience different gender dynamics, right? And now when people are talking about budgeting, devolving, the funds and all this, we're asking ourselves, much as this is going to happen, is it going to be done equally? Or they're going to look at the gender dynamics as far as the demographic aspects are concerned? Then definitely if this is going to happen, then they have also to look at the sectoral distribution of budgets. Now, there's also the other aspect which has been spoken here is about policies. Now, Janet, I'll tell you one thing is very true. Strategies, policies, priorities, all these play a very key role. Yeah, and if at all we are talking about unpaid care, we are talking about domestic, work which is not visible, which is not quantifiable, which is not measurable, then there is a need for the government to come in and say, no, this aspect can be measurable. And that's why we are talking about the time survey, model. We are talking about the independent time, model, which can be used to really measure how much of this is going into it. And if we can be able to measure how much the women put in terms of unpaid care and domestic, work, if it can be measurable, then I think there is no stoppage for not budgeting for this, for not coming up with policy formulations, which have strategies that will put women first. Now, when Ansese was just talking about the aspect of domestic work, I was just looking at how invaluable women have been made to be. Look at a child who is going to school. They only know it is the father who pays fees, but how much of it is this woman putting in just to create, that space for this gentleman to pay the fees? Ideally, what I can say is that if we can be able to measure this, put it into policy formulation, put in strategies, and give a budgetary aspect towards the same, I guess this is very important. Thank you so much, Janet.
Thank you very much, Dr. Wangila, for those remarks. That last bit there about how invaluable the level of contribution that women are seen to have. Let me move on to Ms. Frida Givuku, Executive Director of GROOTS. We've heard again, a lot of the presentations that have been made today have spoken to different ways and elements in which unpaid care work and women economic empowerment can be achieved. Maybe you can speak to investments that are required to recognize, reduce, and redistribute unpaid care and domestic work, and the key stakeholders and the roles that they play. You're a stakeholder, what role are you supposed to play in ensuring that there is recognition, reduction, and redistribution for unpaid care and domestic work? Frida.
Thank you, Janet. I hope you can hear me well. And
yes, we can.
Good evening, everyone. There are different ways that, of course, we can recognize care and domestic work. And perhaps I'll speak to three of them. One is, of course, through the frameworks, through development of policies and legislation. And it is good to recognize that Kenya, of course, is a signatory or has signed up to the SDG Goal 5, which has a very specific target on unpaid care work, target 5.4. The other things is around domesticating policies on care work and domestic work. And it's also good to know that the SDGA, the State Department of Gender, is at least at its formulation stages, at the very initial stages in the development of a policy on care work. So that demonstrates some level of recognition at the country level. Of course, different legislation, we know, unlike the US, here we do have and enjoy parental leave, both maternity leave and paternal leave. Of course, I also listened to Carol speaking about the time use survey that the Bureau is doing, something we are all excited about. That also demonstrates a level of recognition for us as a nation, and we are looking forward to that data. But most importantly is when we will be able to include that in the national account so that we are able to value this work and the contribution that it has on our GDP. I think there are many investments that as a nation we can make to reduce care and domestic work, to reward it, and just to demonstrate that we do value the contribution of care and domestic work into our economy. And I know, I think it's Professor Mbithi who spoke about the sectors that are most impacted by care work. So increasing public investment in water. Imagine in a situation where all rural women had access to water in their household, regardless of which corner of this country they are in. It would mean all the time that they spend fetching water. Some spend an entire day, others a half day. They would use that to do other work. And it's not to mean that this work is not important, but I think it is important to appreciate the level of effort that goes into it. So investment in the water access, whether we call it last mile connectivity or whatever, but getting the water to the household. Investment in energy. A lot of women in Kitui, in the Asal region, in Kilifi, wherever in our country, spend a lot of time looking for firewood, first of all, which is unclean cooking. But even when it is unclean cooking, it is not accessible to them. That is their time. If we are to invest in access to clean and affordable energy, which is another SDG goal, then again, we are already reducing the amount of time women spend doing that. But there are also gap left in public services, whether it is in the health sector, whether it is responding to gender-based violence. I work at Roots and we do a lot of work around responding to gender-based violence. And I look at the amount of time our members spend rescuing people and supporting people to go through the healthcare system, to work with the police. That is work ideally that should function. If the system was functioning properly, the women would not be coming in and other community members, including men and boys who are champion in ending GBV, to do that work. So investing in gender responsive public service will also ease out the labor and the burden that we've loaded on the system, on the women because of the gaps in the system. Tax policies, it is always unfortunate to see every time that we are loading tax on issues like gas, we expect it is women who do the cooking and they rely on this energy every day, probably 3 times in a day. So when you increase the tax on this product, you're saying that the women have to go back to charcoal and all the other form of energy, again, overburdening them. So there are different interventions that we can have, but most importantly is also the change, the social behavioral change. And the social behavioral change is because there's a cultural mindset that we've put in ourselves, maybe because of the way we were socialized for both men and women, that we identify specific roles with women and girls and others with men and boys, that we have to rethink. If we are to redistribute this role, we need to see men and boys, of course, engaged in doing more care work and easing the burden that is on the women and girls. But overall, the most transformative tool for me is education. If we review our syllabus, if we make our syllabus more gender sensitive, then we'll grow an entire generation of people who do not associate certain tasks with gender, with men or with women. And that way we'll have probably dealt with 50% of this challenge. And you asked about the stakeholders. Usually we'll talk about the ministries because of the making of the policies. We talk about civil society because they
I think, Frida, you've hanged. I think it's because of her connectivity. We'll see if we're able to, if at all, come back to you. But Frida was just about to speak to the stakeholders. Oh, there you are. Yes, Frida, you have about 1.5 minutes if you can just allow us to then move to the next speaker. It's still a bit disconnected. I think you've still hanged. Okay, are you able to share that, Frida? If not, you can add your last points to the chat box, if that will help just allow everyone to look at what you're saying. But Frida has also spoken to something critical in increasing public investment, even in things like fetching water. Interestingly, because as in Wadada, we're doing a campaign called Sex for Water, forcing women and girls to trade sex in order to access water. So over and above the economic hindrances for fetching water, there's now the burden of rehabilitation around gender-based violence. So thank you for speaking to that very interesting point. Dr. Caroline Najema, will come to you, a senior gender and GBV specialist. We've heard a lot of what's been said today. It's so hard to kind of narrow it down to how we can speak to evidence presented. How will evidence presented here inform future work by this particular COP? And evidence and knowledge gaps that still remain. If you can somehow speak to the evidence and knowledge gaps and then how that can be used. Yeah.
Thanks, Janet. I think for me, listening into the various conversations, that we've had today, I would like us to go beyond the unpaid care burden, because when you're looking at matters women economic empowerment, unpaid care is just one of those components. And today's discussion basically highlights the need for an intersectional approach to addressing matters women economic empowerment, and also the need for us to use the evidence to shift some of the narratives that have continued to perpetuate some of these inequalities. And this particular community of practice really seeks to be able to bridge the gap that has continued to be there in terms of we have knowledge that has been generated by different actors, but that knowledge is really not translating into action across different levels, either at the policy level or even at the community where we need to start transforming some of the harmful norms that we've talked about today. So through our community of practice that basically has brought in people from the different fields, academia, we are looking at private sector, we are looking at the civil society organizations, and also the donor world. How can we use this particular platform to pull together the evidence that is already out there, the evidence that is currently being generated, to show what works towards women economic empowerment? And when you're talking about women economic empowerment initiatives, it's also with the hindsight that women are not a homogeneous group. So what do we need to do to ensure that the solutions that are being created out there speak to the different constituents of women that we engage in day-to-day work? And secondly, how do we have the researchers on this particular community of practice platform being able to translate and synthesize the evidence that is generated in a manner that the community members can be able to resonate with it and also be part of the team that will tailor solutions, so that then we don't tailor solutions that don't really speak to the communities that we serve. And as Carol from Kenya National Bureau of Statistics had indicated, really we cannot emphasize the use and the impact that data will play in helping shape some of the discussions we'll be having on the community of our practice. So being able to use the evidence that we will be showcasing through the platform to influence some of the government priorities, and also to be able to engage with the donors to look at what are some of the shifts that need to be made in funding realignments, not only in Kenya, but also in beyond. Because one of the things that we are looking out for is that through our community of our practice, we will not only engage at the national level, but we will look at the regional engagement and the global engagement that we are part of, as various stakeholders. And lastly, for me, I look at this particular platform as one that would help us get to a point of having a multi-sectoral approach to action. Multi-sectoral approach because we've realized that there are various areas in which we can reach the women with empowerment initiatives. So once we identify those avenues, we will also identify the various government players that play a key role in shaping the policy actions for that particular thematic area, be it climate, be it education, as has been mentioned by Frida, or could it be matters around water? Basically looking at every area that we know women's voice need to be heard. So how do we bring all these constituents together so that then we together co-create solutions? And this is what the community of practice really seeks to do. Pull together existing evidence, identify the gaps that are already there, and help tailor make solutions that really speak to the need on the ground. So the woman is at the center of everything that we do towards empowering them as beneficiaries of whichever interventions. Over to you, Janet. Thank you.
Thank you. Thank you so much. The woman at the center, but to your point, there's also the support network and community around that also needs the information. I think speaking to the multi-sectoral approach and an intersectional approach as well. So that's our panelists. We have Ms. Anzatsewere, Ms. Frida Githuku, Dr. Wangila Fanis-Feather, and Dr. Caroline Ajema. Please, if you have anything, you have another 10 minutes or so to ask them in the chat box. For now, I'd like to invite Mr. Crispin Afifu, Gender and Women Economic Empowerment Specialist with ICRW Africa, to talk to the next steps before inviting Dr. Chimarauke Izubara to speak to the closing remarks. Karibu.
Thank you so much, Janet, and everyone else that has presented. So mine is just to allow us, just to be able to give us sort of a head start on where we are heading to. So number one, this activity which we have to do, but now we'll get another way of doing it, is that this community of practice is for all of us. And so we're going to have a system or a leadership in place whereby we are proposing to have an 11-member steering committee consisting, of course, of the relevant government institutions around the international organizations with local presence in Kenya doing work, local organizations are doing research, and of course, academia and the private sector. So we can get at least 2 organizations from each of those categories that will constitute a steering committee, of which it's going to have very, some of key functions. One being, of course, developing the vision map of the community of practice, and of course, trying to define what benefits the members will accrue from it, the government, and of course, the target population, in this case being women of all cadres and donors alike. This steering committee also establish or at least propose rules of engagement, which will be adopted by all of us, get a structure and the roles of each thematic committees that shall be established. It will also provide ideas for visibility and branding of the WeCOP. And lastly, it will be able to develop peer review mechanisms for the COP partners and of course the work that the COP partners are doing. So that is how we're going to move forward. Then number two is in terms of membership. I've seen one of you or a few of us asking questions, what's the membership like? The membership is actually diverse, and it's open to researchers and practitioners from nonprofits, private, public institutions who are engaged in research, including ministries, departments, commissions, and agencies of government, county, this is the COG, Council of Governance, and of course the academia. We will have 3 tiers. We will of course bring this back to all of us to agree that those that will be funded, that are already being funded by Gates, and most of us here are, that those or other grantees who are in the WE space and of course supported by other partners, and of course local implementing partners, so that we're able to know how to package the evidence for implementation. Now, we will also have a number of different types of meetings. We will have consultative meetings by technical working groups. We also have those will be monthly meetings. So we will share a calendar on how that's going to happen. We will have capacity building and technical assistance meetings, which will be determined how that will be, because different organizations might need different capacities to be built in different ways. There will be full COP progress meetings, or thematic webinar series. So this is just the first one. This will be held quarterly, so we will be organizing to know who's going to say what. We also be able to showcase the work that is being done by partners. This is biannually, and also we're going to have COP targeted virtual roundtables, workshops, and panel organizations in how to package evidence for awareness creation, attitude and behavioral change, and of course, packaging for policy for app. That's where ActionAid comes in to take it up. Another thing in terms of moving forward is that as the COP, we're going to develop a website. We're also going to have a Dropbox for curated repository of living and resources for policymakers. All the presentations you've made today, all the works you've done, all the reports, and the links to those reports for all the members shall be, of course, archived in this repository, which of course members shall have access. We also be able to work with ActionAid led Advocates Coalition in terms of development of policy asks. We will also work with the national, county, and the grassroots implementing organizations in packaging evidence for awareness creation, attitude, and behavioral change. Another one of the last things we'll be able to do now moving forward, because we don't have time, we will share with all of you Doodle links to determine the most appropriate dates and time for the meetings that I've already mentioned. We will have an online registration link once again, which of course I will provide key contact persons for each organizations who are able to make decisions on WeWork. We will also provide an online form whereby, of course, all of you, there might be organizations that are doing multiple works within a WE space. So we will have all that for stratification. And of course, we also carry out sort of a quick survey to determine the capacity needs for each of the organizations. So lastly is we are requesting that after this, you share with us your high quality logos or branding guidelines so that then we will be able to use them in the website that we are about to develop. We are also going to use them in branding of the materials that we will do, and also for online and offline publications. This is what is going to be a way forward. And so for now, we'll be using a lot of email communication as we move on. So wherever you see the email coming on, please respond, and we'll be able to take it up from there. Thank you so much.
Thank you for that, Crispin. Very clear way forward and key next steps that I hope everyone has noted. And as I invite Dr. Chimaraoke Izubara, Acting Director, ICRW Africa, and Director, Global Health, Youth and Development, to share closing remarks. There'll also be a request for everyone, if possible, those available at the end to have their cameras on, for a quick screenshot of those who are present today presenting and in the panel. Over to you, please, Dr. Izubara.
We wanted to, yeah.
Thanks very much, Janet. And I think it's been a very informative and insightful session. Quite a number of very important issues we are raised, and I thank everybody who participated in this session today. Let me note also that as the sessions were going on, I kept on monitoring the attendance in this event. And at some point in time, it came to slightly over 90, which for me shows not just the importance of the topic of women economic empowerment and specifically of unpaid work, but it's also an indication of the hard work that has gone into the production of this section. So I want to extend my gratitude to everybody who's been part of this meeting and session today. There is also a sense in which it's a test of the things to come. So I want everybody to stay put and watch this platform and space as we move forward. And for all of this, I want to thank everybody who has been part of our success today. Specifically, I want to extend my thanks to you, Janet, for the excellent work you've done in terms of moderating this session, for keeping all of us together, and for keeping us organized. Moderation is a very rare skill, and thanks for the excellent and wonderful job that you've done today. Our presenters, I think you all did a very marvelous job. And thanks for sharing your important work, for the rich insights you brought on this table, and for many of the things that you alerted us to. I think there was a lot for us to chew on, and personally, I will continue to chew on some of these things for a long time to come. The panelists all did a very marvelous job in terms of broadening the discussions and also enriching our understanding of some of the issues that were raised by the presenters. I don't want to underestimate the importance of the participants who joined us today. For your comments, I thank you. Some of the comments were in the chat boxes. In the chat box, we couldn't get to all of them. Some of them, I also was monitoring what was happening on Twitter, and there was a lot being tweeted from today's session. So I thank all of you for that. Some of the questions were not answered, but I think for me, that leaves room for further engagement on some of the issues that were raised today. I would like to also especially commend the Kenyan government officials who joined us today from different units, KMBS, Ministry of Gender and all that, for speaking to us and for all the commitments you have alluded to in today's meeting. Thanks for being here. Our funder, the Gates Foundation, we cannot thank you enough for the investments. We cannot thank you enough for your faith. We cannot thank you enough for the support to this partnership. And we promise that we will do our best to deliver on the commitments, to deliver on the promises that the COP has made. Last but not the least, I want to commend my colleagues at ICRW for working with different partners to be able to pull this event together. Personally, it was an excellent, very excellent outing, and we just have to keep this momentum and quality moving forward. I think the list can get longer, but I don't want to waste time. So let me pause here to say thanks everybody for the work today. Thanks everybody who's worked behind the scenes. I know there were lots of meetings, lots of engagements outside what we've seen today to make this a success. Please stay safe and watch out, and we'll be coming back to you with additional communication as we march forward on this agenda. Thanks very much.
Thank you so much yourself, Dr. Izugbara. Thank you for your words. Thank you for your closing remarks and for the incredible work you've all done here today. Again, another quick request. I know that we're just past time, but if everybody is able to switch on cameras just for a quick photo op, those who are comfortable doing so. It's a request for the speakers and panelists, if you could all just switch on your cameras and just leave them on for about, I don't know, 15, 20 seconds, just so that we can have the team working behind the scenes take a screen grab. And just following what Dr. Izugbara said, we applaud you. We thank you all for your excellent work. We'll give another 5-6 seconds for you all to put on your cameras, and then we'll work with whoever is on here. So I'm going to give us all to mentally count 10 seconds with a nice smile on our face, because I can't be posing and moving my mouth. So, so just 10 seconds or so, if everybody could just hold a pose as we take the shot. Okay, how awkward was that? Thank you, you all looked great. So I think we have it. I think we have the picture. Thank you all so
Thank you,
much. It was an
moderator.
honor and pleasure. Yeah, oh, thank you so much. It was an honor to moderate you all. I feel like there's so much more we could have discussed. Here's to many more sessions and conversations. And rope us in, storytellers and creatives and amplifiers. Let's cascade this across the board. Asanteni Sana,
Yeah.
thank you to everybody who was here today. I appreciate you, and let's continue to have these amazing conversations. I could name you all, but we'll be here for another amount of time. So to everyone who was a part of today, thank you. God bless you. Stay safe, and hopefully we'll see you very soon. Goodbye.
Bye.
Bye, everyone.